We're live, Zubeida. I can see you. Stage. Thank you so much for joining. How are you?
Alhamdulillah, finally the day is here. The day we've all been looking forward to.
Honestly, finally, the day is here. I'm super excited.
Well
I'm
done,
super
well
excited.
done. First.
Thank you so much. How was work today?
Well, Alhamdulillah, I just got back.
Oh, that's good to hear. I can see some people joining. Please, if you can hear us, just type in the comment. Thank you so much for joining. It's going to be a September to remember. Information about PCOS is not something you get every day. Yeah. So that is why I'm excited we are doing this. So if you are here, if you can hear us, please drop a comment that you can hear, and we wait a bit, then we start. I hope the rest can join on time too, so that 9 maximum we are done with this. Yeah. People are joining. Oh, people can hear us. Amazing. Thank you so much for joining. You can see Joy saying she can hear us. Thank you for joining. I hope you have your paper and pen ready, people, because even me, I have a paper and pen ready to jot down some important things. So if you don't have your paper and pen ready, you should. You might want to because you need it. Thank you for joining. Let me play something. Thank you. Welcome. Thank you for joining. Seeing a lot of people who are joining us. Thank you for joining. Go and get your pen and paper ready. You might need it. Zubeida, how was your procedure today? You told me you were in the theater.
Yeah, so I had like 3 procedures today. So I've been at work since I've been in theater since like 9.
Okay. Okay.
So we
Oh,
had 3 egg retrieval, and yes, then we first some embryos, and that's basically all for today.
okay. Okay.
So we'll go
That's
back
that's
tomorrow to see how our babies are doing overnight.
oh, that's good. I pray it's okay. IVF is something that's more like a 50-50 chance, something
Is
like
yeah,
that.
50. But we're
Mm.
always praying for the best. It's really not easy, but
I understand, right? We pray for the best.
yes.
Yeah, I understand. Okay, Gloria is here. I'm trying to bring the other speakers on board. We don't have them yet. So I'm going to
Okay,
have
so
to
I see
try
messages
to
from the group saying that they're unable to join.
get in.
Some people are complaining. I can see questions from the group. So please, if they can take care of that, they're unable to join.
Why? Why can't they join?
I don't
They
know.
just go live on our what's it called? They'll find it there. Live on our YouTube.
Yes, I
To
think
the
if everybody can just click on the link, it just brings you directly to the.
oh, I think it's bringing them to the studio. Let me see. Joy is in the studio. I'm bringing Joy up.
Hello, ma.
Yes, Joy. I can
Okay, I'm trying to address the link issue on the group.
hear. Okay, no problem. That's fine. So you could just mute your mic. Just that.
All right, ma.
So we have people viewing us already. I can see some views. So people should just join directly on our YouTube or check on our YouTube. They'll be able to go live. Just share Joy, if you can hear me. Share the direct. You could as well share
Yes,
the direct.
I've done that, ma.
Yeah, you might not share this particular link, the other direct YouTube link. Share it with them. They will see it live.
Yes,
Join. Exactly.
yes, I've done that.
All right. Thank you. So I think this is the studio. We're supposed to have just 10 people in the studio at the backstage for the speakers to join. All right. So thank you so much for joining. We'll start very soon. We'll start very, very soon because we have a lot to discuss and we wouldn't want to waste anybody's time tonight. So thank God our first speaker is here. I'm so excited that our first speaker is here, so we could go on. Then later the rest. Oh, we are live. Someone is saying we are live. Thank you so much for saying that. Yes, we are live. So we'll just give 6:10. We'll start by 6:10. Zubeida.
Okay, that's
Start by
fine. So we
so
have
for
five
more people.
minutes.
Yes, we have 5 minutes to go. So let me
All
just play
right.
some music thing then. We have 5 minutes. Someone says it feels amazing witness this. In fact, it feels more amazing for me to see you all here. So happy to be here. Ayatollah, welcome. Thank you for joining. Tori B, thank you for joining. I'm glad you guys are joining. Thank you so much. I'm glad a lot of women want to listen to what PCOS is, and it's a big deal. This is the right time for us to get enough information about it. Yeah. Thank you so much for joining. Please, if you are here and other people are not here, start inviting them, because once it's 6:10, we are going to start. We are not waiting for anybody. Once it's 10 minutes past 6, we can start immediately. So if you don't want anybody to miss out, please start calling them so that they can join us on the call. Thank you. Akinola Okpeyemi, thank you so much for joining. You said we are glad to be here. I'm so happy, Ma. I'm super excited too. I'm super happy to see you here. Thank you so much for joining. We have 2 more minutes to go. By 6:10, we are just going to start. If you want to invite women in your corner, you want to invite girls that you know, please, this is the right time to start inviting them. After this webinar, I wouldn't want anybody to come to my DM and start asking me that. Idris Motorayo, peace be unto you too. Thank you. All right, it's 6:10. So we have 2 more of our speakers that wants to join. So I'm just going to permit them in so that they can join. We'll have to kick some people off from the studio. Okay. Okay, so that's all right. So Joy, please share your screen. Let's see your screen because we have a screen that will introduce our speaker. But before, thank you so much, everyone, once again for joining. Pastor Okwemi Lawal. We have our other speakers, okay? Great. Rennie KG.
Good evening, ma. Can you hear me?
Evening.
Fine.
We can't see. Seems you're sure.
We don't have lights, so you can't see me. There's no
Sorry.
lights here.
It's all right. No problem. That's
Everyone like.
all right. So, mute your if your mic is not open. Stop yourself. The way that mute yourself. Your mic is not open. So, please mute your mic. So, we're about to start. I think someone noisy. Is it Joy? Joy, please mute. We're about to start. Thank you so much. So please share your screen. But before we go ahead, let me just make a quick introduction. Then we start already. Thank you so much, everyone, for joining once again. My name is Kauthor Okwemi Lawal. I am a public speaker, I'm a founder, and I'm the founder of Eluke Natal Care. So basically, what we do at Eluke Natal Care is an organization where, okay, the rest of our speakers wants to join, okay? Oh, thank you, Mary, in case you've changed your background. We can see you better now. So as I was saying, yeah, Educate Natal Care is an organization where we focus on women's health from pregnancy to childbirth. And hey, a lot of people are disturbing me from the studio. Please just join us directly. You don't have to come to the studio. Just join us directly. You don't have to come to the studio. The studio is mainly for the speakers so that I can add them on stage. So as I was saying, Eluke Natal Care is an organization that is focused on the care of women from pregnancy to childbirth and after childbirth, because we realize that a lot of women do not have adequate information and knowledge to care for themselves during pregnancy. They just know that they get pregnant and anything happens, they don't know what to do, they don't have the right information, especially women in underserved communities. So anything that has to do with women's health, I am so passionate about it. And this is the reason why you're seeing a webinar like this, because late last year, I just said something on our pregnancy and delivery support community. We have a pregnancy and delivery support community, and we currently have over 1,000 women there. So we're just gisting one day, and I mentioned something about PCOS, and unknown to me, a lot of people came to my DM telling me, oh, this has been bothering them. A woman said she has PCOS and her husband is not happy about the whole thing. Another woman said she does not have kids because she has PCOS. Another woman said she does not even know how to manage her condition. Another woman said she does not even know what PCOS is, not to talk of managing it. Then that was when I saw it as a problem, that actually a lot of people do not have adequate information and knowledge about PCOS. Okay, why don't we do a documentary? That was when we started bringing experts together. So our documentary will be discussed later, and how you can access the documentary will be discussed later in this webinar. Yeah, but before the documentary launch, I said, oh, why not we bring a powerful webinar? After all, September 1st to 30 is PCOS Awareness Month. So why not? So that a lot of people can join us, a lot of people can hear a lot of information about PCOS, can know what causes it, you know, how to manage it and all those things. And immediately I put it out there, people were excited because PCOS is not a talk that a lot of people talk about every day. It's not something you just get information every day. If you go on Google, you can't get that adequate information on Google. You cannot get that adequate information on Google. Google will just give you a peripheral overview on what PCOS is. It won't tell you exactly what PCOS is. But here we are. We have amazing speakers that are going to be talking to us today on everything you need to know about PCOS, and they are going to be answering your questions. I hope everyone here is loaded with questions. Bring up your questions. Once we are done, our speakers will speak. Once they are done, we're going to load them with questions and they are going to answer us. Share your experience. Tell us what you are not happy with. Give us questions so that we'll get to answer. This is the reason why we are here today. I'm excited that we are doing this for free, because a lot of people reach out to me and they're like, why are you doing this webinar for free? Because it's something that a lot of people do not have information on. This is the best time for you to make money and all that. I was like, well, this is just me, and I want everybody, I mean everybody, to have access to this webinar. I want everyone, because if we put some kind of money to it, a lot of people that might be a constraint to a lot of persons. And that was why I said this webinar is going to be free for everyone. I'm excited that all our speakers, when I reach out to them, they say yes. This is something that the majority need to have information of. This is something the population need to have information on. So why not we do? So thank you so much, Zubeida, for joining us. Thank you so much, Moreni Keji. Mrs. Okereke is here to be here. Thank you so much. And for other people that have been doing the planning before now, thank you so much. I appreciate you guys. So let's go ahead. Joy, please share our screen. Let's introduce our speakers so that we can go ahead. So we have the first person, which is Yusuf Zubeida Muhammad. She'll be speaking. She's an embryologist. We have a whole bio about her. So I'm just going to say one or two things. Then once Joy joins, she's going to share our speaker's bio, right? She's an embryologist. She works hand in hand with IVF doctors. She works in an IVF clinic. And I'm so excited she's on board today, because she's going to tell us the relationship between your eggs. I mean, how your eggs, what happens with your eggs and PCOS and fertility. You know, they are all linked up together. The eggs is one very important thing that has to do with reproduction. And if anything goes on with your eggs, problem. So she'll be talking to us about it. And if you have questions, please do well to ask your questions and to be answered. Am I audible? Can everybody hear me? I want to be sure everyone can hear me. Please, you're watching us live and you can hear me. Just type yes, we can hear you. Yes, we can hear you. We're excited. Please let me see your messages if you can hear me. Okay, someone said, yes, I can hear you. Amazing. Motunraye said, I can hear you. Baoki said, I can hear you. Sumininu said, I can hear you. Oh, I'm super excited. Thank you so much. So we'll get to see. Thank you. I can see you. Thank you. So we'll get to see our speaker's bio, because unfortunately, the person that is supposed to do that, she's not online at the moment. I don't know, maybe she's finding it difficult to join. So I think I've said a little bit about Zubeida, and Zubeida will be saying one or two things. She's already smiling on the screen for you all to see. So Zubeida is already smiling on the screen. So when she's done talking, Moreni Keji will talk, then we'll have our third speaker and all of those things. So thank you so much, everyone. Zubeida, over to you, please.
Hello, everyone. I don't know, can everyone hear me?
Yes, I can hear you from my end. Very clear and perfect.
So I'm sure everyone should be able to. Hello, everyone. Good evening. And finally, it's the day we've all been waiting for, our PCOS webinar. It's it's a pleasure and an honor to be here. With so many amazing women to be talking about PCOS, a hormonal issue that is faced by so many women around the world. So if you're going through PCOS, just know that you're not the only one. There are so many women they are going through same struggles as you. So Alhamdulillah, it's an amazing to be here. Thank you to the founders of this platform for putting together such an amazing webinar to talk about PCOS. So as my moderator has already introduced, my name is Yusuf Zubaida Muhammad. I am a clinical embryologist and a reproductive health advocate. So if you're wondering, clinical embryologist, what do we do? Okay, so we're scientists. We carry out the whole IVF process in the lab. We see what your eggs looks like. We collect your eggs, the sperm, put them together, and have your intending embryos, and they are transferred back to your womb, and hopefully by God's grace you get pregnant. So that's basically what we do. So talking about PCOS, so PCOS, as we all know, is a hormonal disorder that affects millions of women around the world, and it's not new that PCOS is among the leading cause of infertility. So when you put women, like 10 women together, there's a very high possibility that 6 to 7 of these women will come for fertility treatment simply because they have PCOS. So that's how much PCOS affects the quality. That's how much PCOS can actually impact fertility and make it difficult for you to get pregnant. So what happens during PCOS is a hormonal disorder, right? And there's so much going on in our body. There's so much processes that's going on in our body. So once there's a little imbalance, or once the level of a hormone that's supposed to be released is too little or too more, then there's going to be a problem somewhere. So that's basically what happens during PCOS. The male hormone tends to be more in people with PCOS. So it makes it difficult for them to ovulate. It makes it difficult for them to have their period regularly. Some of these women, you see them with hair on their chin and so many other symptoms that PCOS comes with. And when we're talking about fertility, there are two major gametes that happens during fertility. We have the egg and we have the sperm. So from our side, that's we the women. What do we give? Is the egg. So once there's a problem with the egg, the sperm will not be able to fertilize the egg. And once there's no fertilization, pregnancy cannot take place. If ovulation is not happening, the eggs cannot be fertilized. So that's the problem with PCOS. For patients with PCOS, it's so difficult for some of them to ovulate. And because PCOS is so difficult to manage, and because it comes with different symptoms, so what works for A might not work for B. So let me tell you how or what this PCOS does to the quality of the eggs. Because there's so much going on in the body, there's so much stress, and the hormone that is not supposed to be there, which is the male hormone, is being produced, is on a higher level than it's meant to be produced. So this affects the quality of the eggs. Let's start with the growth, the maturation of the eggs. If just like you plant, let me use a plant as an example. You plant a seed, or you get a seed, and then you see you have a seed, you have different seeds, whatever you're planting, you have different seeds. Each seed, once there's a problem with the seed, probably with the shape of the seed or something, or probably a parasite or something have actually perched on the seed, it might affect the growth of the plant that you're whatever which might affect the growth of whatever you're planting. So that's same thing with the quality of the eggs. Because there's so much stress going on, because there's so much going on in the body, that the normal regular process, it affects the growth of the egg. The human egg, there are different qualities of the human egg. The human egg, we can have a MET1, a MET2, a GV, and so many other ways that we actually qualify the quality of the egg. So if the egg does not attain the normal growth that it's supposed to get to, there will not be fertilization. This sperm will not be able to fertilize the egg. So that's simply what happens with PCOS. That's how PCOS affects the quality of the egg. Also, with PCOS also affects the cytoplasm of the egg. So just the same way we have our regular egg from the chicken, where you have the outer shell, we have the inner shell. I'm sure there are some cases where you have some egg, and once you crack them open, some of them tend to be very watery, or something might be wrong with the egg. So that's same thing that happens with the human egg. If there's a problem somewhere, probably there's a hormonal imbalance, just like with PCOS somewhere, it affects the cytoplasm of the egg. And once there's a problem with the inner cell mass of the egg, once there's a problem with the cytoplasm of the egg, this egg will not grow well. This egg cannot be fertilized by the sperm. And if this egg is not being fertilized, there's no way pregnancy is going to take place. And also in some patients with PCOS, and how PCOS also affects the quality of the eggs, is that this PCOS also affects the cellular processes of the egg. So there's so much going on for the egg to form. It needs energy, it needs nutrients and all of that for it to grow. So once there's a problem, once there's a hormonal imbalance, once there's something wrong and the body is not doing what is supposed to happen, the cellular processes of the egg would be reduced. If it's reduced, there's no way it's going to fertilize. And if the egg is not being fertilized by the sperm, there's no way implantation is going to take place. And in some cases, if implantation peradventure takes place, let's say places where you have 50-50, okay, let's assume that it got fertilized. It's the egg is not so good, but let's assume that it got fertilized, right? Along the way, it might stop growing, because from the beginning, the embryo did not form well and all of that. And once you don't have a good embryo, there's no way implantation is going to take place. And that's why I see some women, they might get pregnant, and along the way they'll have miscarriage. Why? Simply because the intending embryo that is being formed is not properly formed. It does not have all the cellular structures. It is not properly formed. And with this, there's no way that the embryo is going to implant in the womb of the woman. So these are ways in which PCOS can actually affect the quality of the eggs. Anything that has to do with reproduction involves the eggs and the sperm. So this egg is I would say is the most paramount important aspect of you getting pregnant, because there's no way you get pregnant if the egg is not being released. There's no way you get pregnant if the egg is not being fertilized. So those are part of the struggles that come with PCOS, and that's why most times patients with PCOS will now result to IVF. Since if you're coming for IVF, your whole process of the body and everything is now being managed by the doctors, by the nurses, by the embryologists. So with that way, they are able to give you medications to aid how these eggs will be released, to aid how these ovaries will release more matured eggs and all of that. So once these ovaries are releasing the eggs, rather than the normal body process where one egg is being released every month for you to ovulate and have your period, if you're coming for IVF, the stimulation process, the drugs that are being given, the injection and everything will help these ovaries to release multiple eggs. Do you get? So if you have more eggs, you have better chances of getting pregnant, because you know that if the first egg does not have good quality, there's high possibility that the second one will have a better quality. There's another possibility that the third one will have a better quality. So that's where IVF comes in, because you're able to generate more eggs. I don't know if you understand. You're able to generate more eggs, and the whole treatment is being handled outside the body. So the other processes that might affect the implantation from taking place, probably due to hormonal issues, and all that is being avoided, all that is being taken away, because the everything is being done outside the body until the final day. And also, even in the lab, even in the embryology lab, when we're growing these embryos, there's every possibility that it's not all your embryos that are going to make it to the final stage. There's every possibility that it's not all your embryos that would fertilize. But because you have multiple eggs being generated for you during your egg retrieval and all of that, so now you have more embryos. So there's possibility that if embryo one does not make it to the second day, there's possibility that at least the second one will make it to the third day. So with all of this, with IVF, you are able chances of better looking embryos. And also because before embryos are being transferred into the endometrium, the Embryologists are actually able to see the embryos. They look at their cells, they look at their structure, they look at their everything. So they're able to tell you the best quality looking embryos to the endometrium. Yeah. So with this, you have higher chances of getting pregnant rather than when you let your body do the normal body where it chooses your egg for you. It tells the sperm, okay, now the egg has been it's the sperm, go and fertilize the egg, story, and so that's where IVF comes in. That's where IVF helps patients with PCOS. And because PCOS is so difficult to manage, the symptoms of PCOS for A may vary from the symptoms of PCOS for B. I've seen some ladies with PCOS that do not have hair, but their problem is they don't see their period and all of that. Why I've seen some ladies with PCOS, they are overweight, they have hair, they are not seeing their period. So many symptoms varies for different people with different people with PCOS, and that's why it's so difficult to manage PCOS. So even if you come to the hospital, we've had patients where the protocol of treatment which you use for A, for same patients with PCOS, you might not be able to use that same protocol for patient B with same PCOS issues. So PCOS is so difficult to manage. But if there's one thing I always tell anyone with PCOS is you cannot rely on one option when trying to conceive, when you're trying to manage PCOS. You have to have a combination of everything that might help your issue. I've seen some people that said, okay, well, I had PCOS. I started taking some people said beetroot. Some people tell you, oh, I took this supplement and I was able to get pregnant. The next person might do same thing and they will not still get pregnant. Do you get? So as much as you're relying on one means, probably you're working on your lifestyle modification, you're trying to lose weight, because weight is a very, very important aspect when you're trying to get pregnant. If being overweight affects the quality of the eggs, it reduces the quality of the eggs. So even if you're coming for IVF, or even if you're trying to get pregnant and you're overweight, your doctor is always going to advise you to try to loosen up some weight. They'll tell you to adjust your diet, what you eat, and all of that, because our body is so sensitive that everything we do, especially we ladies, every single thing we do affects something somewhere. So when you know that your body already has a problem, like you're dealing with PCOS, you already know that there's something somewhere that is wrong. There's a hormonal imbalance that is wrong somewhere. So you're trying A, you're trying B, you're trying to combine everything just so it can help you to manage your symptoms and help you to manage the PCOS more easily. So most times they'll tell you, okay, you should work on your lifestyle modification, lose weight, eat a healthy diet, do this, don't do that, don't do that. You get, but you cannot just rely on that. At the same time, you have to also get medical intervention. You have to also do this. You have to also do this. So dealing with PCOS is very, very difficult. I've seen patients that have PCOS come for IVF and still they don't get pregnant. So managing PCOS with medical intervention, without medical intervention, it's always difficult. But that does not mean all hopes are lost, you get. But I know it can be tiring. Today you're trying to manage this, tomorrow you're trying to manage this. Like, it's so difficult. But it's still better than not even making efforts at all. And what I always one mistake I realized that a lot of ladies do, a lot of people with PCOS experience symptoms from a very young age. And I don't know, is it because there was no much awareness, or because a lot of people do not know about PCOS? I've seen a lot of people is until they get married and they are trying to conceive, that's when they realize they have PCOS. Meanwhile, they've been seeing these symptoms right from puberty. Probably they've not been seeing their period. Their period are irregular. But we Africans, we have this thing, oh, don't worry, it will be fine. It's just time, just because, and over time they let it be till when it's time to conceive. Do you get? Early management of any symptom you have is the key. And that's why I was excited when I heard about this documentary, about the whole PCOS documentary. I know it's going to be amazing documentary, because you have different clinicians. You have the embryologists, you have the doctors, you have different people talking about one issue, PCOS, because that's how difficult PCOS is to manage. One person cannot manage PCOS alone. you're working with your dietitian is saying don't eat this. You're working with your doctors, the doctors say don't do this. You're working, do you get? So when I heard about this documentary, I was like, we're looking forward to it, because you know it's so amazing to bring different people for just one purpose, to talk about just one purpose, which is PCOS. Do you get? So if there's one thing I just, like I said, I have noticed that with a lot of people with PCOS is that a lot of people do not realize they even have PCOS until it's late. A lot of people do not even seek medical intervention for PCOS related issues until it's late. So that's all part of the problem that comes with PCOS. So this is an amazing way. This is an amazing way to create more awareness of PCOS, because I believe there are so many people living with PCOS that do not even know they do not even know that they have PCOS until they are finding it difficult to conceive. Probably go to the hospital, and that's when they realize that they have PCOS. So that's just basically it. I hope everyone heard me.
Yes, we did. Thank you so much. I was
Yes, we
just
can hear you.
Oh, sorry. I'm
yes.
sorry. I hope I'm talking too fast. I have a problem with talking fast.
No, that's entirely fine. I was just trying to jot some things as well as answer some questions and all those things. Thank you so much, Zubaida. So, in one of the things you said
Okay.
eggs are not well implanted. That is
Yes.
why, is there a
No.
particular shape that are having PCOS? Is there a particular shape that the egg have that doesn't make it meet with the sperm? Or can you give us a more clarification on how the shape, or, for example, for those that are living with sickle cell, I'm just trying to bring that example here. For those
Yeah.
that are living with sickle cell, their cell is sickled, like, the cell for someone that is not having sickle cell, it's kind of round, that it completes 21 days and all those things. Now, for someone that is having sickle cell, you see that it doesn't complete that frame. Is that the same way it happens in people with PCOS? Their egg quality. Does it have a particular kind of reduction or a particular kind of shape that makes it not get fertilized because of PCOS?
Okay, so just like the way we have a normal egg, it has layers. We have a first layer, second layer, and third layer. That's exactly how the human egg is, and it's also round like that. It has the shape and everything. So because it's so sensitive, once there's a fragment with the first layer, or once the shape is bending or something, meaning that egg cannot be fertilized, because the sperm needs everywhere to be okay for it to be able to penetrate and fertilize the egg. So once there's a fragment with the shape of the egg, there's already a problem. And even if the shape from the first layer is fine and it starts and it got fertilized, but along the way the cytoplasm of that's like the inner cell mass of the egg is not forming well, this intending embryo might not do well. And if you don't have good embryos, there's no way it's going to implant. And sometimes even if the intending embryos manage, struggle, gather all the energy, the nutrients and everything with all the medications they are giving and everything, do you get, and they manage to implant, there's possibility that this pregnancy might not take place. That's why sometimes you see some women along the way will actually have miscarriage, because the intending embryo is not of a good quality. And sometimes also, if the intending embryo is not of a good quality, it can also affect the cellular processes of the embryo, which might lead to fragmented DNA. And once you have fragmented DNA, once there's something with the DNA is what carries our genetic material of the body. Once there's something wrong, once you hear, oh, there's something wrong with the DNA, then there's something wrong somewhere. So even if the person is pregnant, probably goes for scan, and then you notice that, oh, the embryo is not forming well, or probably there's a deformity somewhere. All this starts with the egg. All this starts from the embryo. So I hope that has answered the question.
Yes, it does. So what you're trying to say is sometimes in people who have PCOS, there might be some kind of shape or some kind of deformity, maybe in their eggs, and that
There's
is why it doesn't get fertilized with sperm, right? So I also wanted to, is there a particular stage in which, but I'm just asking this because this is what is going through my own head, right? I'm
okay.
sure a lot of people that they want to ask you as an embryologist. So if you are just joining us, we have Yusuf Zubeida Muhammad. She is an embryologist, and she's trying to tell us how the quality of the eggs in a person with PCOS, how it affects fertilization and all those things. So I will encourage you to listen attentively and also get to answer your question. So what I'm trying to say is how often, or let me say, how early can a person identify, oh, my eggs might not be doing well, or my what's it called, the embryo might not be doing well, for me to go for a proper checkup, and it won't lead to when I'm trying to conceive? Because there's something that resonated with me while you were speaking, and I
Okay.
used to say well that a lot of people do not have information about PCOS, and that is why they only get to know they have PCOS when they want to conceive. Yeah, and that
Yeah.
is break. We want people to be aware about these conditions, so that the earlier they're able to identify this condition, the earlier they're able to get help. Yeah. So how often can, probably, let's say, a girl child or a woman knows that, oh, my eggs are not doing well, or it's fragmented, or it's not whatever, just the way you are explaining it to your own embryologist terminologies and all that. So is there a way that people can diagnose this thing on time, so that they can go for proper treatment, and not when they get to, getting married or conception, that is when they will now get about to know all these things?
Okay, with the way just sorry, with the way our body works and everything, it's sad that you can't know the quality of your eggs except when you come for IVF. Even we embryologists we're only able to tell you the quality of your eggs because we can see them under the microscope. So even before IVF, before we retrieve the egg, we can't tell you that, oh, your eggs are not doing well. Your egg is a MET1, your egg is a MET2, your egg is a GV or anything. Do you get? It's only when you come for IVF and we retrieve these eggs and we're seeing them in the lab under the microscope. That's the only way we can tell you, okay, no, there's a problem with the egg. Okay, this egg is not properly formed, so meaning it's not going to fertilize. Do you get? So that's the sad part of it. So if you're looking for early symptoms of PCOS, that might give you a sign that, okay, something is wrong with the body. I think the earliest and the easiest of them is when you don't see your period. Because normally as a girl, once you attain puberty, it's normal. The normal regular process is for you to see your period every month. So once you don't see your period, that should give you a signal that something is wrong. That should give you a signal that something is wrong somewhere. But because there's lack of awareness, because there's no proper awareness, no proper knowledge of reproductive health issues. So over time, I've seen a lot of people who don't see their period, and their parents or their aunties just tell them, oh, it's normal. Along the line, your body will meet up, or along the line. And you know how when you start your period, the cramps, the pain, and all. Do you get? So you're still very young and naive at that age. So once you don't see your period, sometimes you don't even tell anybody, because you're so happy you're not seeing your period. You're so happy you're not having cramps or anything. Do you get? So the easiest way for you to have a signal that something is wrong with your body somewhere as a lady is when you don't see your period. Because just the normal African way of saying, okay, how you know you're a woman is when you start seeing your period. Do you get? So if you're supposed to see your period, or your period comes and this much you don't see it, like I think before, a lot of people say if you don't see your period you get pregnant. Do you get? So like your period is your first sign to know that something is wrong somewhere. Once you don't see your period, something is wrong somewhere. Once you're not ovulating, as a lady, you're supposed to know how your body works and everything. So once you're ovulating, you're supposed to monitor the flow of your discharge and everything. Do you get? So with this, once there's a change somewhere, you know that, okay, no, it's high time I go to the hospital to see a doctor, because I don't like the way my discharge is coming. How come my discharge didn't come this time? Do you get? How come I'm not seeing my period? How come this is happening? How come there are some women that lactate? Do you get? How come I'm having milk coming out from my breast at this age? Do you get? So it's something that you should be worried about. So the earliest and the simplest way that you can notice that there's something wrong with your body somewhere, it's your period. Once you don't see your period, or once there's a delay that's abnormal, I think that should tell you, okay, that something is wrong somewhere, and you should go to the hospital to see your doctor.
Thank you so much, Zubeida. I can I was just blending with a lot of things. Aside the fact that I am medically inclined, something that is not your field. I've done a lot of research about PCOS. That's because I'm a person of knowledge. I like getting information. And then I'm putting out a webinar. I answer questions from people every day. I answer people questions. I get to know more. So I've done a lot of research about PCOS. But however, what you are saying now, I've not heard about that, telling us how the eggs is, what you see under the microscope, and all of those things. I'm glad you were able to tell us how that works, how the eggs is, shaping and all. And the best way people can get to know these things is when they are able to, maybe probably they are not seeing their period or they are seeing something strange. It's very important because sometimes, as we are growing up as a girl child, don't let me even come to woman yet. As a girl child, sometimes, like you said, in Africa, when you are not seeing your period, a lot of people will start telling you, oh, you are still small. Your period will regulate later in life. There is nothing
Right.
like you are small.
Yeah.
Yeah. Once you start your period and it's not forthcoming again, and then you should know that something is wrong, because the period will not just stop except you are pregnant. That is the way nature does it. So once you are not seeing your period, you should go for a scan, check if you are having any condition, go for an hormonal profile test, check if you are having any issues, and start treating it on time. See a
Time, yes.
gynecologist so that they can
Apologies.
start time. Thank you so much, Zubeida. We really appreciate you. Is there anyone that wants to ask any question regarding how your eggs is formed and how it affects a person living with PCOS and your fertility? Please, you have questions, start dropping them. I will see the questions. Yeah, look at our beautiful Zubeida on the screen. Please go through her profile so that you can see her and all that. If you're in Abuja, she's working in a fertility clinic in Abuja. Feel free to reach out to her if you want to do IVF and all that. I'm sure she's going to get you the best doctors and the best hands. She's working in a fertility clinic. So if you're in Abuja, do well to reach out to her. Okay, someone is saying something. Please, should we be able to make okay? Okay, someone is saying something. Let me check. I think they have a question for you. Okay,
Okay.
someone you that it's very enlightening. Thank you so much. Someone is asking of the symptoms of PCOS. Well, do you need? I thought you mentioned something like the symptoms of PCOS. Okay, someone is asking you that please should tell her the symptoms of PCOS. There are a lot of symptoms that occur in PCOS. So if you could tell them some,
Yes, and
I would.
yeah, and symptoms varies from person to person. A lot of time, a lot of people don't see their period on time. Some people they find it difficult to ovulate. Some people they have facial hair. Some people they are being overweight, and so many other symptoms that PCOS comes up with. But the easiest and most common in all patients with PCOS is abnormal period, irregular period. That's like the easiest and the most common for most patients that have PCOS. So I
All
hope this
right.
has answered the question.
Yes. Much. Okay. For the person asking that question, there are so many symptoms of PCOS. Like Zubeida told us, one of the things a lot of people, let me say 90% of those living in PCOS, or let me say 95% of those living in PCOS, one of the high, or let me say top rank symptoms is irregular periods. Then we could have other things like acne. A lot of them have acne because of the level of androgen level in the
Yeah,
system. We also have hairs. You see hairs, facial hair on the face, hair on the chest, and all that. And that is due to the androgen level as well. Then, one that is also very common, although not in everybody having PCOS, is excessive weight gain. Yeah. Although there are some people that have lean PCOS, they call it lean PCOS. You see someone that is so lean, I mean, someone like me, and the person is having PCOS and the person is not adding weight. But 50% of the people that have PCOS, they usually complain of excessive weight gain. Then we could talk of other things like not sometimes they may not ovulate and all of those things. So those are the symptoms that come with PCOS: irregular periods, acne, facial hair on the chest. What again did I mention? And all those things. So there are a lot of like
yes,
Zubeda said, varies in people.
from person.
Yeah, varies in people. Some persons might have a particular symptoms, and another person have a particular symptom. But there is at least one or two things that is very common in everyone that have PCOS, which is irregular periods and higher of androgen. I think those are the two things that usually very like 90% of those living with PCOS, you see that they have higher androgen level, and you see that they have irregular periods. So
Yes,
I think
androgen is what makes them. That's why you see some of them with beards. So for some, you can see the beards is really full, but why some, like under their chin, you can actually see that they have beards.
yes, that's true. Some will
So the
even have two, and they start picking them. They shave
yes,
it off, all of those things. Yeah. So thank you so much, Zubeida. I think you've spoken for like 20 minutes or more.
wow,
So thank you so much. A lot of questions. There are lots and lots and lots of questions. But
wow.
I think someone is saying thank you so much. Okay, someone is saying irregular discharge and spotting. Well, I wouldn't want to take that. Acne, yes, amazing. We have a lot of people that are living with PCOS here, so they are telling us from their experience. Someone is saying hyperpigmentation, amazing. Someone said I gave birth to two kids and I was diagnosed with PCOS and I bled for 3 months. Oh my goodness. So sorry about that. Please don't bleed for 3 months. So you might be anemic. If you have PCOS and you keep bleeding over and over, please go to the
Sorry.
hospital so that they can give you certain medications for your period to stop. Because if the period does not stop, you might run anemic. And if you are anemic, may God help us. We will not say another thing here. Okay, someone says she's overweight, she has irregular period, she has facial hair, and she lost her pregnancy in second trimester. Oh, we are so sorry about
You can
that.
see
Zubeida,
what I was telling you about, right? You get
exactly.
pregnant along the way because the embryos were not okay. Along the way, you have a miscarriage.
Yeah, I know of someone too that has PCOS. She's currently in her documentary. That is why I'm encouraging everyone here tonight. Don't forget to, in fact, as that documentary is launching, don't forget to watch it. So she lost two pregnancies because she had PCOS, and they told her embryo is not very well and all of those things. Do you understand? So that is why I resonated well with what Veda was saying, that if you have PCOS, you are at risk of having miscarriages and all. There are a lot of questions that we can't take now. I think after the session, we'll start taking the questions one after
One,
the other. We still have two more speakers, like questions. There are a lot of questions here, a lot of questions. I'm so sorry, but we won't be taking the questions now. Or let me say, after Mureni Keji, then we can take like 5 questions, then go to the next speaker and take another 5 questions and everything. Thank you so much. So, Moreni Keji, is Moreni Keji there? Thank you so much, Zubeida. Please stay on the call.
thank
You can off or whatever, but please stay on the call so that those that want to ask questions, they will be able to
you.
get their
I'll be
questions.
taking a few minutes off. I'll join you back shortly. Let me just pray and I'll be back.
All right. Thank you so much. All right. So we have the second speaker, Moreni Keji. Moreni Keji, are you there? Moreni Keji, are you with us? Moreni Keji, can anybody hear me? Please, if you can hear me, type. We'll answer all your questions. I can see a lot of questions. Okay. Okay. What's it called, when she's back, because I can see a question here that has to do with the eggs. Okay, thank you. You can hear me. Someone is saying, I can hear you. I can hear you. Oh, thank you so much. Thank you so much. Okay, Zubeida, you've not gone. Someone is asking a question relating to the eggs. Zubeida, are you there? Okay, I don't know why Moren Keji is not with us. I really do not know. Oh, I think Moren Keji is off the call. She'll be back soonest. She'll be back soon. So, okay, Zubeida has left us. She'll be back as well. So, let me get to answer some questions. Let's start answering some questions before our speakers get back. I think our network is fluctuating, so that's why she's not been able to join. So, let me All right, someone is asking here that, okay, we've answered the symptoms of PCOS. Then someone is asking, is it possible to have PCOS and still have a regular period? Well, I've not really seen that. Yeah, I've not really seen that. A lot of people having PCOS, they have irregular periods. And in fact, that is one of the reasons why they go for tests. Because once you start having irregular period, they start questioning that why are you having irregular period? And you go for PCOS, then you are diagnosed of PCOS. So I don't think it's possible for you to have PCOS and still have your period regularly. Yeah. When I mean regularly, some people will see their period this month, next month they are not seeing it, next 2 months they are not seeing it, and all that. So that's an irregular period. Or some will see it in the next 6 months, they won't even see the period again. So that is why we have someone that is currently living his PCOS that is going to share her experience with us. She will tell us how our symptoms were, if she was seeing a period or she was not seeing a period. But from experience, I have not seen someone that has PCOS and still have a regular period. Yeah. From experience, I have not seen someone that has PCOS and have regular period. Maybe Moreni Keji is going to tell us if that is true or that is not true. But for the person that asks, I don't think it's possible to have PCOS and still have regular period. If you have regular period, then they might not diagnose you of PCOS. But it's because of the irregularity in the period, they'll tell you to go and see a doctor. Then they will diagnose you. Okay, they are seeing you are doing a scan, they are seeing this cyst, you are seeing these symptoms, then they can now diagnose you of PCOS. So that's a Moreni Keji. Are you there now? Can you hear us?
Yes, I am. Can you hear me?
Yes, I can hear you. Perfect. Your network went off sometimes ago.
Oh my God, it's raining heavily here.
Oh my goodness. It's raining so
So the
heavy.
network is very, very terrible.
The network is breaking. All right, so sorry. So we'll have Moreni Keji. Moreni Keji is our second speaker. We are still going to take a lot of questions. Please be patient with us so that we can round up on time. So we have Moreni Keji Olaniran. Moreni Keji Olaniran is our second, Olaniran. Yeah, she's our second speaker. And she has been living with PCOS for over 17 years. And she's going to share her experiences with us, her struggles, her pain, what she has gone through, if she had support from anybody, if she does not have support, what it has been for her. Oh my God. I'm so excited we are having you tonight, Moreni Keji. Thank you so much. Please, let's see Moreni Keji's profile. Joy, please switch to her profile so that a lot of people will be able to see her amazing profile and who she is. Can you see? Joy, can you please read her profile a bit for us before we go ahead?
All right, ma'am. Morenikeji Olaniran is a dedicated advocate, researcher and trainer at the MO Reusable Pad project and the project lead at Central for Teens Health and Development. Our organization provides trainings on reusable parts making reusable parts making and promotes the well-being and holistic development of teenagers in Nigeria through education, personal development, reproductive health, and skill empowerment. She holds a degree in child development and family psychology from Olabisi Onabanjo University in Ogun State and human rights, sexual and gender-based violence at Abo Heritage University, USA. Morenikeji is an alumni of YALI, Mentor Her to Greatness, Nigeria's Sustainable Development Goals Advocate, United People Global Sustainability Champion, African Women Leadership Forum, and associate at NG Youth SDGs, amongst others. Morenikeji is an ambassador for My Best app as an advocate for mental health. She is passionate about promoting youth advocacy, mental well-being, and reproductive health of women and teenagers. She is an active volunteer. Through her work in organizations, she has empowered and supported girls and women in underserved communities and IDPs in Nigeria. She is open to collaborations that foster community development.
Thank you so much, Joy. Thank you so much. So She has a very fat and robust male, and she told interacting and when you like to be a speaker webinar coming up, of course I would love to tell you. She has been but just if you want to be PCOS for over 17 years. Joy, please mute background is a bit noisy. Who can tell you the symptoms, the pain, the struggles, everything, like someone who has been living with PCOS for over 17 years? Trust me, no one. Because she has seen the good, the bad, she has seen everything, at least from our own personal experience on what PCOS is and how PCOS has impacted her life, her journey, and her marriage life and everything. And she has been living with PCOS uh, 17 years now. She's going to be sharing her experience with everybody here. So I encourage you to pay attention so that you can get to learn and ask your questions from Moreni KG. Moreni KG, you have the floor.
Good evening, everyone. Can you hear me?
Good evening. I can hear you. Please chat in the
Good
box if
evening,
Moreni
everyone. Can you hear me?
can hear Moreni KG. Someone said yes, I can hear you.
Okay. Okay, thank you very much. I'm so sorry about my network. My network is so bad. It's raining, so I will just try and increase my voice. I'm sorry I can't put on my camera because there's no lights in my house, in my area rather. So I will just go straight to the point because of time. I started my menstruation in GSS1. I was 12 years old. I Prior to that, I've not heard anything about menstruation. So when I saw my period in second term, I felt, oh, I guess I'm injured or something happened to me. So I just like, okay. I didn't tell anybody because I was staying with my dad, my dad and my stepmom. So my stepmom was kind of really nice, opposites. So she was somebody I cannot just have that kind of conversation with. So when my period came, it was not normal. So the first month it came, spent 3 days. The next month it came, spent 4 days. Then it stopped. It stopped coming, and I was concerned, but I really did not care because I didn't even know anything about menstruation. So I was like, okay, thank God, no more stress. And I was telling my friends, and they were like, "Oh, I want to be like you. Oh. I will not see my period, or all this period, wahala." And I was happy that people want to be like me. I felt it was a good thing. So it's then in that first month, it came for 4 times in that year when it started. Then when I got to SS1, always came to our school to talk about menstruation and everything. And deep inside of me, I was worried that this is not normal. This is not what I just learned. But there was still nobody to actually like show my concern. So let me just say youthful exorbitance. I just swipe it off. I was not worried. I was like, okay, when the thing is ready to come, it will. So in 14, I became worried. Like I just became worried because it was years. It just ceased. It stopped coming. And sometimes it will come twice in a year, it will come 3 times in a year, and it will just dry up. So I became worried and I went to the hospital. I was told that maybe you have infection, or and my period still did not come. So I went to see a gynecologist. That was in 2014. And the money they told me, I was not buoyant there. I didn't have money. So I was like, okay, I started. Then in 2019. Please, can you hear me?
Please mute your mic. Zubeida,
Yes, sorry, I'm trying to change location.
Okay, can you hear me?
yes, I can hear you, Moreni. You can go on.
What an estimate.
Please mute your mic. Thank you. All
Okay.
right.
Okay. So I started and I went to see a gynecologist in Ogun State, and I did a lot of tests, and that was when I was diagnosed with PCOS. And the first thing the doctor said was, are you married? I was like, no, I'm not married, I'm in my final year. And she was like, okay, it's not a big deal. She was just trying to like talk to me, I think maybe motherly conversation. And she said, if you are ready to get married, you can come over, we're going to give you injection so that it will be easy to get pregnant and all that. And when I went online to read about it, and I realized that it was a big deal. And through all these years, my period was still coming 3 times, 1 week, 3 times 1 week, and it still comes 3 or 4 times in a year. So it was not. I became worried. I was like, okay, I will not. I think marriage is out of it. I am not going to get married because I don't think anybody will want to be with somebody that will be on their period, and the period is off and on. Please let me know if you can still hear me, please.
Yes, yes, yes.
Can hear you.
Hello?
Yes,
Go
we can
ahead, we
hear.
can hear you.
Can hear
I
you.
can hear you at my
Okay,
end.
thank you very much. Okay. So I said, okay, I'm not going to get married because what about if I don't get pregnant? I was so worried, and I just okay. Okay, I just decided that okay, I was not going to get married, and there was really no support because I was an orphan. I was an only child, so there was really nobody I could actually like tell my problem, my worries. So I was just managing it, and I had a friend, my best friend Eunice, and when I'm in the low down, I'll call her, and she will tell me that okay,
Mreni Kiji, I can't hear you any longer. Am I the only one that can't hear her?
I think it's a network.
Okay. Let's see if she's backstage. Okay, Mreni Kiji is backstage. No, she's still on the stage. Mreni Kiji, can you hear us? Mreni Kiji, are you there? Okay, so you can see that PCOS is actually a big deal. She didn't want to get married when she was supposed to get married because she was thinking who would marry her because her period is not stable. She's not seeing her period. Is there any man that's going to marry her? And that's because of the little awareness people have. Yeah, Mary Keji is happily married. I know Mary Keji personally. Her husband is a loving man. Yeah, the man support her, take her to the hospital, do this, do that, and goes on with her. But with the level of low information and the awareness that we have in this country, not only this country, anybody could think of that who would marry me, or I might not even say yes to anybody because my period is not regular. And that is why even some people that are currently in marriage, they are still facing that kind of the same situation. Yeah, they are still having the same situation because their partner is complaining that we don't even know what PCOS is. Are you sure you get pregnant? And all of those things, a lot of things like that.
oh
So you can
sorry, man.
actually,
Hello?
yes, Maren KG.
Okay, sorry, my network went off. Sorry.
So
So
you
can
can,
I continue?
yes, please.
Okay, so I started, they told me not to eat rice, and rice is the regular food that Nigeria have. So they said I should be eating brown rice. I was just trying to get better, and I was still not worried because I think by then my situation was still normal because my period was still coming 3 times in a 3 times 7 times in a month when it comes. So I think as I grow older, the symptoms became terrible. Then in 2020, my period started coming like 6 times in a year. But this time it used to come like 1 month. Like I will have my period from 12 July to 12 12 August. So it was like 31 days. And sometimes I will have it for 60 days. And it was terrible. I started that was when I started my organization. Because I could not afford regular sanitary pads because I could use a Veroni. I can use like 20 pack, like 20 of that full pack of Veroni. I used to change 10 times or 12 times a day because it was heavy, full of blood clots. and it was like so heavy, and it stayed for a long period of time. So I was worried. So I went to the hospital again, and they told me that, oh, it's normal, it's part of the PCOS, you have to take this drug. So I was on contraceptive. They said they were going to use it to regulate my system and hormones so that my period can start coming. And it did not work, because when I start the medication, by 1 month it will stop the period. Then maybe after 3 months it will come again, and it's still 1 month on my period with blood clot. And at some point I used to faint because I don't have blood. And when I go to the hospital, they are like, your PVC is 10%. So it was like a life and death problem for me. So when my husband came, I know my husband was very sweet. When he was like, I want to get married to you, I was like, sit down here. So I told him everything, even though my family and friends were like, don't they tell me that kind of thing. So I was like, which man will be with me for 1 month or 2 months, will not have sex? So I wanted to be on the same page with anybody I was going to do relationship. I just wanted a man that does not see menstruation as dirty and one thing. So I told him, and he was like, okay, no problem, let's do it. I was like, what about if I don't give birth? He was like, don't worry, let's do it. So we got married. I had to so when I went to the hospital, the gynecologist said, in here in Abuja, the gynecologist was like, okay, this is 2019, it's been a while. I went to a general hospital, and they said, you don't have PCOS, you have hormonal imbalance. They gave me drugs, and it did not work. They said he was going to regulate my period. They had to give me a drug that will make my period come.
Mreni Keji,
See another Ghana.
are you here with
Yeah,
us?
can you hear me?
Yes, I
Yes,
can
I'm
hear
with
you.
you.
All right, thank you. You can
Okay,
go
sorry,
ahead.
but so I had to go to another private hospital that have all these big machines for hormonal tests. So I did all the tests again, because the gynecologist said 2019 is a while, so I should do it again. So I did it because the Fenty was getting constant, and my PVC will be 10%. I needed blood to survive, because the way my PVC was always low, and fruit or vegetable could not revive it. So I needed a blood transfusion. So it was just back and forth, money spend. And this thing did not happen when I was younger. So I was worried, and the gynecologist did all the tests again, and she said, okay, I have PCOS. So I have been on medication. I've been on medication since January this year. I have been taking drugs every day, morning, evening, to try and regulate my hormones so that my periods can come. But you just see the same thing: heavy bleeding with blood clotting. After the bleeding, start passing out, transfusion, and everything. So it has been exhausting. Like, I don't know the word to use, because it's crazy. At some point, when I wear pad, my lap will be peeled because there is no hair. I'm always on pad and underwear. And when I wake up, just 2 minutes wearing pad, I've stained. So most time going outside is an issue, because when I go for conferences or program, I hold a lot of pad, and 2 minutes, like, my alarm rings, so I go to change or check if my pad is filled up. So it has been terrible, and I won't lie you, it's a place where I do not pray for somebody to be in, because aside the mental stress, the sleepless nights, the depression, the mood swing, the sadness, the money, the resources that it has consumed. But I'm just grateful that at least I have the resources to, like, do this test, get these drugs, and I have a partner that is very, very supportive, and supportive in all ways. So about this, aside before my husband, I really did not have support apart from my friend. And I have a lot of people say, no man go marry you. I even have an auntie that went to give me a divorcee man, a 60 years old man, because she said, I don't think somebody, a man, a young man that have not given birth will want to be with you where you menstruate for 1 month, 2 months. Even we that give our husband every day say that they cheat, not to talk of man will not have sex with you for 2 months. So it was heartbreaking, but I like they say, which report will you believe? So I just trust that okay, maybe my own will be different. So when I was open for relationships, I just that was my focus. Somebody that don't see menstruation as a death and all that. So that has been my journey over the years. This year will make it 18 years that I have had PCOS. I've been living with PCOS, and it has been wow because I sometimes people will be like, how do you do it? You're always busy, you're always smiling. An issue because people will be like, you have to reduce, and you keep doing exercise, you keep eating once a day, but you're gaining weight, and people will feel, oh, you're lazy, you don't do exercise. I just feel it's a lot. So I know society can be so harsh. You don't the fat, you just the fat anyhow. A lot of comments like you just the fat anyhow when you go born. You just go marry, just the go program, you just the get award when your mate don't born. So it's a lot, and it's funny because it's coming from my own family. So my whole family is doing that, and I'm just sitting down looking sometimes and like, okay, what if I don't have a supportive partner? It would have been crazy because it would have because people are so harsh and unkind. So that is my experiences. So thank you very much for listening.
Oh my goodness. Oh my God. You know that word, people are unkind with their words. I think we need to do better. You know, while I was talking with you, you didn't tell me to this length. You just told me you had PCOS for 17 years. And just take a look at all these struggles. The only people, kind of people that I've known that have PCV of 10% is those that are suffering from, what's it called? Sickle cell. Those are the only people I know that, oh, the PCOS can even drop to 5%, and they are, you will see us in the hospital running up and down how we are going to get blood and start transfusing them. Sometimes we might even do open transfusion, just to save and revive that person. Now think about you. You've been living with PCOS and you faint because of a condition you don't know how it got there, because of a condition that happens to you because you're a lady, because of a condition that happens to you because you have ovary, you have uterus. Really, I think we need to be more kind with our words. This generation is not the best time to see people and start asking them funny questions like, why are you not pregnant? I mean, what is your business if someone is not pregnant? Or why are you getting fat? I understand the fact that some people can say it from a loving place. Yes, it's understandable. But however, I think we have to communicate it in a way that people will see that you care, not in a way that people will interpret it like, oh, this person is making jest of me. If I had not had PCOS, we should be talking to me like this. Or if I don't have this condition, we should be talking to me like this. For everyone here, or for everyone that will still listen to this, please, I beg of you, I think we need to be more kind with our words. We need to learn the kind of words we say to people, because these people are having a lot of struggles. They are battling a lot of things. Thank you so much, Melanie KG, for sharing your story with us. So, a lot of people have dropped questions, but before I go on with your questions, I just want to ask you certain things. How has it been for you mentally, psychologically? Because I saw someone wrote a post like, PCOS is beyond fertility issue, and I understand. Yes, PCOS is beyond fertility issue. I mean, yes, fertility is the major problem. That is where a lot of women are concerned when it comes to fertility, because they don't want people to start asking them, when are you getting pregnant, and all of those things. But when we look at these women backstage, do we think about their mental health? Do we think about what they are going through? Do we think about the days they just sit down in the toilet and cry so much? We went to Lekki when we were doing our shooting for the documentary, and one of the women we spoke to. She's a very popular woman. So we asked her, and she said, okay, let me tell you, every day of my life I cry. She said, I've gone past the stage of crying, but every day of my life, I sit in the toilet, I cry because I bleed for a very long time. And people don't see these things. People don't see how much you bleed. People don't see how much you hold in those struggles. So, my question is, how was it for you psychologically, mentally? Are there days you've even thought of, I mean, suicidal attempts and all those? Because I know someone, there's also someone we featured in our documentary. She tried to commit suicide 3 times. She has been married for over 9 years now. She doesn't have a child. Her family is not helpful. Moreni Keji, you have a caring husband. Yes, her husband is caring too, but she doesn't have a loving family. I mean, the family of her husband and all those things. They literally bash her all the time. I don't know them, but these are the things she tells me. We live in the same estate per se. She usually tell me that they bash her all the time. They mention comments like, you are just eating and sleeping, you don't want to give us a child, and all of those things. And this affected her mentally, that she tried to commit suicide 3 times. So you can see that is psychologically draining. So regarding that, how was it for you? Have there been a time where you just think of, oh, let me just end it? I don't want to put this man into suffering again. Are there times you are fed up? Are there times you just tell God, God, why me? Or why is this happening to me? Are there times it has messed up with your mental health and your mental states? Moreni Keji, are you there? Oh my God. I think she was not even there. Moreni Keji, did you hear what I asked?
Can you hear me?
Yes, I can hear. Did you hear what I
Yes,
asked?
I did. Can you hear me? Yes, yes.
Okay, so please tell us, are there times when PCOS, having PCOS,
Yes,
or
they definitely. Yes, they are. There's a lot of times. There's a lot of times I'm just like, God. At some point, I stopped going to church. I said, God, God, this God don't love me, because if He love me, why He let me one? Now let me waka come. So I have questioned my existence. Like it was a lot. At some point, I was like, okay, no problem. I started drinking. Because I could not sleep for like 3 years. I could not sleep at night. So at night, my eyes are just open till daybreak. And then I was in school, so it affected my grade. And people, they don't just understand, because you can't start telling people that I didn't see my period. Some of them be like, you don't know what God do for you. So a lot of persons, then they didn't just get it. Like, there are sometimes people are sympathizing with you, but there's some people will be like, I understand how you feel. They don't. So I just feel most time people use that statement to like console you, that I understand. Because me too, I did not understand how I was feeling. My feeling was not feeling. It was just there. So there was a lot of sadness. Like even now, I'm like this year, it has been full ups and down. Like imagine you are not sick for malaria, you're just taking drugs, hormonal drugs, and this thing mess up with your mental health, with your mood, with everything you're living your life. It does. So yes, it has been draining. I have At some point I was suicidal. At some point I just like, okay, I was isolated, let everybody just be on their own, because nobody understand how I am feeling. Yes, especially with the comments, nobody's going to marry you, all those plenty things. You're just getting fat. At some point, one of my aunties saw my post and commented, that was I think 4 years ago, that you just the fat, where you dey fat, you are fatting like a fat fool, you have never even gotten married. On Facebook, I had to block her because I could not insult her because she's older than me. So it was a lot. It was a lot, but yeah, we are still pushing it one step at a time.
indeed, one step at a time. Moreni Keji, you've gone through a lot, honestly. And when I see you, anytime I see you, when I come to Abuja, I'm just going to hug you tight. So remember, in fact, don't even remember, because just get ready. I'm going to carry you. I'm going to hug you tight when I see you, by the grace of God, because you've gone through a lot. You said don't try for this life, yeah, because you've actually gone through a lot. And I'm glad that. Are you there? Can you hear me?
Yes, I can hear you.
And I'm glad that you are seeing it in a positive way. I mean, you are seeing your condition in a positive light. You are not, you're not, it's
Yes.
not as people's talk will not get back to you or will not get to you,
Mm.
but you're not letting it weigh you down. You still go on with your
Yes.
organization.
I have stopped feeling pity for myself. Like I've done that all these years and it did not yield any results. So currently I don't feel pity for myself and I don't want people to feel pity for me. You get? So that's why most times I always talk about my story so that there is nothing that anybody is going to use to laugh me. You get my
Say
point
again.
because I've owned up to those stories.
Exactly. I think that's one thing. That's one thing that is so paramount. Even if you are here and you are not learning anything, you're having PCOS or you know someone that has PCOS, please encourage them to speak up, encourage them to talk. I think when we share more of these stories, people will not be shy, people will not be stigmatized. Yeah. But it is when you don't share these stories, when people don't know your story, when people don't know about the PCOS, the condition, a lot of people can get to stigmatize them. So if there's anything you want to walk away with or you want to take away from this YouTube live this evening, is to know that if you're a person living with PCOS, talk about it. You don't have to tell the world. I mean, tell someone that is close to you. Talk to your sister. Talk to your friend. Talk to someone. Let that relief come into you so that people will not. And when there's a conversation on PCOS, talk about it. Share your experience so that nobody will stigmatize you for anything. One thing I love about one of our what's it called speakers in the what's it called the documentary we are doing. She said, "Okay, I've gotten to a point in my life that there's nothing you say about PCOS that I don't know. Before you even said I'm getting fat, I'm going to tell you that it's because of PCOS I've added weight." She would tell you a lot of. She said at this point in her life, nobody can stigmatize her. However, on the other hand, we also have someone that is so cold. She's always indoor. She doesn't want to attend events because she has a lot of acne on her face. She doesn't want people to start asking her, can you use this? Can you use that? Have you tried this? Have you tried that? And all of those. Or people start telling her, go and do this to have a child. Go and drink this to have a child. I think a lot of people need to talk more about it. We need to talk more and we need to empathetic. When I mean empathetic, we need to be kind with our words. You don't just open your mouth and say things. Why are you this? Why are you that? I mean, you don't know the struggles people are going through. Thank you so much, Moreni KG, for sharing your stories. God bless you for coming onto this platform and sharing your stories with us. There are a lot of questions that people have for you. So let's just take about 3 to 5 before we go to our next speaker, Mrs. Okereke. Oh, someone said, Morenikeji, are you there? Morenikeji, I want you to hear this. That's why I want to know if you are here. Oh, Morenikeji is not on the stage. I don't know why she's not here. Someone said, you have been through a lot, Morenikeji. I am sending you hugs. Someone said, mental stress. Okay, she's back. Thank God. Morenikeji,
Yes, I'm here with you.
a lot of people are telling you a lot of things. Someone said, you have been through a lot. I am sending you hugs. So receive that hugs wherever you are.
Thank you.
The mental stress, honestly, the resources. Someone said, so sorry, Moreni KG, you've been through a lot. Someone said, thanks for enlightenment. Someone is sending you many hugs. You've really gone through a lot. Thanks for sharing your experience.
Thank you so much.
A lot of people are sending you hugs. Please start receiving your hugs wherever you are.
I'm
Okay.
receiving it.
Yeah. So someone is asking you a question. She said, is it advisable to tell your partner about your condition at the first stage of relationship or
Oh,
in the middle
yes.
after marriage? That's her question. Should you tell
Okay.
him or in the middle or after marriage?
Okay, for me, I think marriage was not all that for me. Like, Nigeria like marriage. For me, I just had because I just had that any man that is going to get married to me is not doing me a favor because I have PCOS. So I was not feeling bad. I was not feeling pity for me that I have a terrible life because I might not get pregnant. Yes. And you see somebody, and the first thing you ask them, what is your genotype? That was it for me. After you are, oh, my name is Moreni KG, what is your name? And I know that, okay, I think I like this person have sense. The next thing is, I have PCOS. And everybody I've been with, I used to tell them, even my friends, as I like, I have PCOS. It was something that everybody know. So when somebody is like, my period is not coming, and the next thing in class, are you sexually active? No. Go me Moreni KG, now she be the doctor. So I had that mindset. You being in my life is because I have a purpose and I have value. So I will tell you, as far I know that, okay, I think I'm liking you, not even before we start the relationship. So you already know that my menstruation is abnormal. You already know that, okay, this girl can be cranky when a period is on. You already know that it doesn't come every month, even before I accept that, okay, I will date you. So yes, you have to tell the person, even so that you don't just be breaking your heart anyhow. So imagine you when you are not serious, you have love up, you now told the person, and the person say, okay, I cannot continue. And many people, our heart is so fragile and important. I don't think any man deserve to be breaking it up the way they like. So tell them, if it's the first day, tell the person, oh, you like me, oh, I have PCOS. It's nothing to be ashamed of. It's not you. You're not the one that made you to, you're not the reason for your PCOS. So it's something you should own up to, because it will be so bad when you get married before you're telling that man. That means you were manipulative. You're a bad person to lie and manipulate somebody. And when the person get married, you are saying, I want to have sex, and you are saying, I'm on my period. They will ask you, you be the woman with the issue of blood. Your period not a dry. So you get those things. So please, it's very important to tell the person once you know that you might catch feeling or you're catching feeling. I hope I answered your question.
Before you catch feelings or you're catching feelings, please tell him. As much as it sounds funny, it is actually not funny, right? So before, okay, I have a story of someone I'm just gonna share here because I've spoken to her a lot of times, and she said, just share my story anywhere, anytime. She's married here, and it's so unfortunate that she's currently in a divorce process with her partner. It's not as if the man did not know that she has PCOS. But at some point, he was not getting a lot of information, a lot of knowledge, and just got tired. So please analyze the person. If you want to marry, if you're not married yet, and you have PCOS, analyze the person you want to get married to. Tell them, let them know, Charlie, I have PCOS, so this is what PCOS is. This is this, that is that, that is that. In case I am going through this, in case I have mood swings, in case I am having low libido, because I've gotten to understand that for people that are married, a lot of things that comes with PCOS is having low libido. You might not even want to have sex. Someone that has PCOS, she said, one of our speakers in our documentary, she said sometimes she can go for 6 months without meeting with her partner. And I'm like, what? A whole 6 months. So that is how terrible it can be, honestly. I think the government should, you know, have a monthly, would I say, a monthly stipend they give people living with PCOS, because the amount of money they spend, psychological stress. I mean, the money they are going to be giving them, maybe it should be for the mental stress that they go through, the psychological stress that they go to, honestly, because I just feel that's the way it is. They go through a lot of things, honestly. They just go through a lot of things. Thank you so much, Maureen KG. So if you are catching feelings, please tell your partner so that if you want to walk away, you should start walking away now, not when you get
Okay,
there.
please, Miss
Like,
Okpe, can I say something?
yes, please say something.
Okay, so when you are telling your partner, don't listen to his words. Listen to the way his eyes is moving. Look at his eyes, his body language. Don't even listen to the answer. Just read his body language and the way the eyes is moving when you are telling them. Because some people can tell you that, oh, don't worry, I'm here for you. But body language never lies. So maybe because the body language, even the statement itself has shown that, this person is not serious, but because of you have already catch feeling, you just assume. So please don't assume. Make sure you are the way he's saying, oh, I don't mind, is also written on his face and actions, that okay, I don't mind. What does this person do when you're on your period? What does this person do when you call the person that, oh, I'm on my period, or anything. So I think there's just reactions we definitely show if this person just okay, maybe this person just wants part-time or wants to have sex and all that. So please, I think that is just so important information I wanted to add.
Wow, thank you so much. That goes a long way. Read your body language in case you tell the man and he shine his eyeball. Know that there's a problem. All right, someone is asking. A lot of people are sending you hugs and hugs and hugs. So someone said, "I wish you the best that life has to offer. Please take care of yourself." Then someone said, "The last thing a lady with PCOS deserves is a spouse that stresses her out about her symptoms or getting pregnant. It's amazing and loving that Moreni KG husband is super supportive." Hey, we are sending your husband more hugs and love. So a lot of people are clapping for your husband. So Moreni KG, are you there? Someone is asking you a question. Hello,
Thank you
Moreni.
so much.
All right. So this person said, is it anyone?
I'm with you. Yes.
She said, is it that anyone infected with PCOS can never be treated with it? Or can it be and get back to your normal life again? I don't know. She's just saying, is it that anyone that has PCOS can never be treated and can you get back to living your normal life again or something like that? So I think
Okay.
that's
I feel everybody is different. For me, I don't have BS. I don't have acne. So I've seen a lot of persons with PCOS that have those things. So everybody body is different, and the way they handle it is different. So I feel everybody is different. So everybody should just take care of themselves.
Oh my God. I don't know what happened. Can everybody hear me now? Can anyone hear me? Am I audible?
Yes, finally.
Yes.
Oh my goodness. Oh my God. Oh my God. I felt so sad for a minute. Like, what is happening? Why is everybody not hearing me? I am so, so sorry. I've joined back. Can you hear me now? Please, if you can hear me, please.
Yes,
Please.
I can hear you.
Thank you
Yes, we
so
can.
much. I was about sweating that Kino Shele, what is happening? Why can't people hear me? I think it was my Wi-Fi, maybe the home Wi-Fi tripped off. I've connected to my mobile Wi-Fi. Thank you so much. Okay, so Moreni Keji, are you there? Someone asked a question before we move to
Yes, I
our
am.
okay. Where's our next speaker? Joy, if you can hear me, please tell Miss Okereke to come on board. We'll be having her next. So someone asked a question regarding regarding your personal life. That's why I want you to please connect me with Moreni Keji and the other lady.
Okay,
Okay.
personal life as in what
Yes,
tense? Yeah.
I'm coming. I'm coming.
Okay.
Let me see the question. She said, so Moreni Keji, how have you been able to manage it, especially as a married woman? Please. I think she asked PCOS she's married to. She said, how have you been able to manage it, especially as a married woman?
Okay, thank you very much. Um, Firstly, what I do is that um I and my partner in the same page, and most times the way body, especially this rainy season, that body will just be doing one kind. So can you hear me?
Yes, I can hear you. Please go
So
ahead.
so that body will just be doing one kind. So sometimes what we do is we use condom, because currently, since this year, I've been having a lot of blood clots, like big one. So I don't want to endanger his health, so we use condom when I'm on my period. And other times I just like romance him and make him okay. But there are just some romance that you just want that thing to enter. So what we do is that we use condom most of the times when I'm on my period. Other times I just like I'm currently on injection and contraceptive to stop it. So currently, if he's still 1 month and he's still coming out, I go to the hospital to get injection that will stop it when I'm tired, like when I'm exhausted of the bleeding. So that's what we do. So if I know that me personally, I want it, I take the contraceptive or the injection to stop the period. And when it stop the period, this thing further notice the periods come. So those periods, I try to, when the period is not coming, when I'm say like when I'm not menstruating, I try as much as possible to satisfy my man. Or I take injection to stop it. So that has been working for us. So that's what we always do. One of those examples. So I hope I answered your question. Can you hear me?
Yes, I can hear you. Can you hear me now?
Yes, I can. I said I hope I answered that question.
Yes, I think so. That's just on another level. Just assume that you don't have a partner that is understanding. I mean, who would want to be using protective with a woman that is married and all those things, and you just want to be using protective and all that? And I'm glad that as you're thinking of yourself, you're also thinking of your partner and see the way things can be convenient for both of you. It is not actually easy. So for someone that asks that question, I hope she has been able to answer your question. So she has told you how she's doing it with her man. So if you want
Mba.
to and all that.
What's in?
So I think that's all the questions we have for now. If we have the third speaker, then we could answer more questions. We have a lot of questions here, anyways. But let's say if we have more speakers, we could answer the question. Thank you so much, Moreni Keji, for
Thank you
sharing
so much for having
your
me. Thank you,
experience.
everyone.
Please don't go off because there are still a lot of questions that people are asking here that you would answer
Okay. I'm with you, even if I have terrible network. I'm here.
for. Yes, please, Joy, switch to the next speaker. We have our next speaker on board. She's Mrs. Okereke. Can you see her beautiful face? Oh my God. This is another one that you're going to pay attention. So, for those that have left because our network, we had glitches and all that. Joy, please send a message to the group that our network is back. They should join. They don't want to miss Mrs. Okereke's session at all. And she's here to give us all the value and all, everything that they need to know about having kids and all that. She has 5 beautiful kids and she's living with PCOS. You can see. So she's just going to share her experience with us. So please go to the page and start telling people to join back. Thank you so much. So Mrs. Okereke, over to you, please. Please share her bio and let's read a little bit of her bio before she starts. All right, Joy, please go on.
All right, mom. Amara Okereke is a mother of 5 beautiful children, PCOS warrior, a metabolic biochemistry lecturer, and a chemical pathologist, advancing her career in endocrinology, study of hormones, hormone-producing glands and organs. Delving into research enlightened me on PCOS and other metabolic or hormonal health issues and how to improve or remit them via lifestyle modifications. My mission is to help people improve their metabolic and hormonal health via day-to-day activities.
Oh, thank you so much for reading Mrs. Okereke bio. Some people say they can't hear me, they can't hear anything. Is that true? Can you all hear me? Hello. Some people say they can't
Yes,
hear
I can
anything.
hear
Am I
you from
audible?
here.
Am I audible?
I can
I
hear
can
you
hear you
from
from
here.
my end.
Yes,
Thank
you're
you.
audible.
I'm audible. Thank you so much. Why can't you hear? Please, you can't hear anything. Please exit and join back. Exit and join back. It's probably the network. So over to you, Miss Okereke. Thank you so much for joining tonight. Please, over to you. I hope your background is not too
Everybody,
noisy.
good evening. Thank you so much, Mrs. Opeyemi, for having me, and I applaud your efforts at mobilizing people for this campaign. It takes empathy to embark on this kind of journey. All right, so before I delve into how I was able to get pregnant naturally with PCOS, I'm going to share my PCOS story to encourage you, to give you hope that having PCOS does not write you off from beautiful life. I've lived with PCOS for 25 years now. I started my menses started heavy at the age of 13. And just like Moronike, I had heavy menstrual flow for 20 solid years. My heavy menstrual flow stopped in, I think, 2020 was when I'm going to share with you here. I had 2 anemic attacks that could have claimed my life. The first one was when I was in 4th year in the university, and with diet and other things, I was able to bring up my blood level. The second was when I was about to get married. It was when I was about to get married that I had the second anemic attack, and I got transfused with 3 pints of blood. And that was enough to discourage my husband from proceeding with this. But I had already told him about my condition. So it's very important, just like Morenike said, that you inform your partner about your condition. I told my husband about my condition, and he was even the one that gave me hope that God was. At that time, I didn't know it was PCOS. As at that time, I didn't know it was PCOS. There was no tag to it. Despite the fact that I visited the hospital severally before I got a proper diagnosis in 2015, there was no name to the condition. All I knew at that time was that my period was always heavy. I kept visiting the hospital and they kept bombarding me with drugs. The more drugs I was given, and until 2000, I finally got married. Why I actually stopped seeking for solution, for therapeutic solution towards my condition in 2011, I stopped going to the hospitals for to get managed. Sorry, I'm a bit on the edge because one of my pronounced symptoms living with PCOS symptom with me, you can hear my voice fidgeting. That's my most pronounced symptom, anxiety. So when in 2011, after I had the second anemic attack and still went to the hospital as usual to get properly managed, the female gynecologist I saw told me to stop coming to the hospital until I was ready to get pregnant. So I took her advice to heart and stopped. My symptom even got worse after I stopped going to the hospital, but I heed her advice and stopped going. And till 2014, when I was about to get married, I had another anemic attack and got transfused. In 2015, after our wedding ceremony and all that, I got a proper diagnosis. That was when it was found out that I had PCOS. That was when I got a proper diagnosis. You know, one thing with PCOS is that you could keep living with the symptoms without knowing that you have PCOS until you're ready to start giving birth or whatever. So it was in 2015 that I got a proper diagnosis of my condition, and lo and behold, it was PCOS. Then I started researching on the condition. And being a medical personnel, I decided having PCOS inspired my decision to advance my career in endocrinology, to proceed and find more information on PCOS. I'm sorry, I think I'm lost. Okay, it was during in 2015 I got a proper diagnosis that my condition was PCOS, and then I started doing more research on the condition. Then in that 2015, I saw a gynecologist. That was when I got a proper diagnosis that it was PCOS. And the gynae I saw drilled my ovary. But after the ovarian drilling, because one thing about PCOS is a complex metabolic hormonal disorder. It's not just a hormonal disorder, it's more of a metabolic disorder than a hormonal disorder. So when I saw the gynecologist, he recommended ovarian drilling, and I did the ovarian drilling and was given some drugs. After some months, I had high expectation that I was going to get pregnant. Nothing happened. Few months after I did the surgery, I started praying, I started talking to God, and some months later, I took in of my first. You know, and before I got pregnant, I prayed for just one child. I asked God to just give me a child. That if you could just give me a child, that would be okay. So after I got pregnant of my first, I gave birth. Like some years later, I wanted another child. Like Oliver Twist, I asked for more. I was requesting for more. So I couldn't get pregnant without I had to take Clomid to encourage ovulation. I know so many of you here must have taken Clomid to encourage ovulation. I had to take Clomid to encourage ovulation. See, please bear with me. Bear with me. I am on the edge, and you are. That's why I'm fluttering. I'm on the edge. Bear with me. I'm stressed out today, and anytime I'm so stressed out, that's how it is. Usually, it used to be. Anytime I'm stressed out, I get on the edge when I'm speaking to people in public. So I've not done my distress routine for some time now because of so many activities on my schedule. Please bear with me, but you're still going to get the juice from my speech. All right, so I took Clomid to encourage ovulation, but the month I took Clomid, nothing happened. Nothing happened until I had an inspiration to alter my diet. And I altered my diet. I started eating more of fruits and vegetables. And within a month of placing myself on fruits and vegetables, I took in of my second child. Then I went on again when I wanted to get pregnant the third time. I read my diet. By then, by the time I wanted to get in and take in the third time, I had already garnered some knowledge on PCOS and how PCOS is a metabolic disorder. So I read my diet of artificial sugar, processed food. And within a short while of doing that, I took in of my third, my fourth, and my fifth, because I had already understood that PCOS is a metabolic condition. I altered my lifestyle, leveraging on that knowledge. And the infertility is just a tip of the iceberg. There are other issues that comes with having PCOS, like diabetes. We are predisposed to having diabetes, we are predisposed to having heart disease, stroke, and endometrial cancer. So knowing that made me to alter my lifestyle to kind of adopt healthy living habits. So I stopped taking refined food entirely. I stopped taking processed food entirely. And that made me to start taking in even unplanned. My fourth and my fifth was not planned. I just took in of them without planning them. And now to PCOS, there are 4 different types of PCOS. Like Moronike said, it has varying symptoms. My symptoms might differ from your own symptoms, and it has varying managing techniques. The way my condition is managed might differ from the way your own condition will be managed. But every symptom in PCOS, every PCOS symptom is rooted in insulin resistance. Every single PCOS symptom, ranging from hair on the face, on the chest, acne, high testosterone, lack of ovulation, every single symptom of PCOS have its root in insulin resistance. Insulin resistance is a condition whereby your insulin receptors, we have every single cell, human beings, we are made up of different systems, different organs, different tissues, different cells. And every single cell in our body, most cells in our body rather, have insulin receptors. And when these insulin receptors are not responding to the binding of insulin, insulin is the messenger that helps your body to take up glucose, that helps your cells to take up glucose. So when your insulin receptors are not accepting the binding of insulin on them, there will be pile up of insulin in the blood, and this pile up high level of insulin in the blood results to immature or improper ovulation. There are 2 different phases in ovulation. We have the follicular phase and the luteal phase. The follicular phase is the duration, is the period when your egg gets matured. Then ovulation is when you release the egg. Now, insulin interferes with the follicular stage. High insulin level interferes with the follicular stage. During the follicular stage, the androgen you produce, every normal woman produces androgen. During the follicular stage, the androgen you produce ought to get converted to female hormone. But due to the high level of insulin, that androgen will not get converted to female hormone, leading to high androgen level. And high androgen level impairs the follicular phase of your ovarian cycle. I don't know if I'm making sense. So that's why women with PCOS don't ovulate normally. But if you are able to tackle insulin resistance, 90% of women living with PCOS can improve their chances of getting pregnant, ovulating normally by boosting their insulin sensitivity. If you are able to tackle your insulin resistance, you can improve your chances of getting pregnant. And how can you do this? You can do this by, one, removing artificial sugars from your diet. Getting rid of processed food. You know, the thing about artificial sugar and processed food is that PCOS, like I said, is a case of insulin resistance. And now, when your insulin is already resistant, if you eat artificial sugar are food that are already easy to absorb form. You know, carbohydrates, the smallest unit or the breakdown product of carbohydrates is glucose, that's sugar. Now, when you eat artificial sugar, it's already in the easy to absorb form. As it's going into your body, it's already in easy to absorb form. So there is no work for your body to do. Once you take it in, it goes straight into your blood and causes a spike in sugar level. And that spike in sugar level, when you eat carbohydrate-rich food and glucose is released slowly into your bloodstream, your brain will sense the presence of glucose and release insulin that will mop up the glucose from your blood. But what happens in cases of insulin resistance is that you have pile-up of insulin in the blood. You have pile-up of insulin in the blood, and this insulin are not working properly. So when you eat artificial sugar that is already in easy to absorb form, this sugar will cause a spike in sugar level. The sugar, I don't know if I'm making sense. The sugar present in the food you consume will spike up your sugar level and cause a spike in insulin level. And this spike in insulin level will keep impairing your success at ovulation. So the first thing you need to do is to address your diet. Remove artificial sugar, processed food from your diet. Processed food ranges from meat pie, bread, any food that is made, that is processed, any food that is not retaining 95% of its nature is processed. Any food that is not retaining 95% of its nature is processed. I heard when Moronike said that she was asked to remove rice from her diet. The reason for that is that white rice is processed. It does not have fiber. The role fiber plays is to slow down the rate at which your body releases sugar into the blood. Sugar contained in the food you eat is to slow down the rate at which your body releases it into the blood. So white rice does not have fiber. Brown rice have fiber. It has high level of fiber. So brown rice will curtail the rate at which your system receives sugar, or at which your digestive system releases sugar into the bloodstream. Then the second thing you need to address after you've altered your diet is to move more. Movement helps your body cells to take up glucose without the help of insulin. Movement helps your body to take up glucose without the help of insulin. So movement, exercising is very essential in improving your PCOS symptoms. Another thing you can do to help yourself, this, like I said when I was sharing my story, the only thing I did was to alter my diet. I was already active. I was active. I walk, I move around, I do so many things, I exercise. So that was the only thing I altered was my diet. But my case might not be like yours. You might need to put more effort. You might need to put more effort in making sure that you ovulate and get pregnant. You might need to put more effort. And like I said, there are 4 different types of PCOS. And the way you manage type A is not the same way you manage type B. And the way you manage type P is not the same way you manage type C. Okay, there are 4 different types of PCOS. There are ones that comes with just the high androgen level and chronic anovulation. There are ones that comes, it's just there are ones that comes with high androgen level and normal ovulation. So the symptoms varies and the way it is managed also varies. But if you are able to, if you can boost your insulin sensitivity, you're going to go a long way in helping yourself to ovulate normally. I'm sorry, I am kind of stuttering doing this because I'm on the edge. And yes, that brings me to the third point. You reduce your stress level. Stress releases cortisol, and cortisol heightens your insulin resistance. Stress releases cortisol, both, and when I'm talking about stress, I mean both mental and physical stress. Stress releases cortisol, and cortisol, and one thing about insulin resistance affects most of the organs. It can affect the brain. Before now, it was assumed that the brain does not have insulin receptors, but the brain have insulin receptors. Insulin resistance can destabilize the way you function, your mental clarity, your ability to focus. Insulin resistance can alter your ability to focus. It can alter your the way your brain functions. Okay, so if you can address your diet, if you can fix your diet, if you can fix your movement, reduce stress, and then you need to do some decluttering in your kitchen. You need to do some decluttering in your kitchen, because being that PCOS is a case of is a metabolic case, like I said, but there are endocrine disruptors, that's hormone disruptors, things that disrupt your hormones that you use every day, like plastics. If you are still using plastics to store your food, you might need to alter that. You might need to change that to something else. If you use detergent to wash items that you use to serve food, edibles, you might also need to alter that. Okay, and if you do these 4 things, there are other ways of improving insulin sensitivity. There are other ways of improving insulin sensitivity aside this, but because of time and because I'm not in my best state now, I'm going to leave it at this 4 points, and maybe in October, I will try to make it a point of duty to share more on my channel, everything about PCOS, and in details, everything about PCOS. I'm going to share it in details in my channel, Healthy Living Nest. I'm going to share it in details. Like I said, PCOS comes with a lot of symptoms. It comes with anxiety, it comes with depression, it comes with low self-esteem, it comes with obesity. Yes, some of you are aware of these symptoms. But my most pronounced symptoms, even with all the healthy living habits I've adopted, is anxiety. And this can only, I know very well, the only thing that helps me to address this is doing some the stress activities. Some stress activities helps me to come. But since today, I've been up and running. That's why I was unable to join early. I've been up and running today, so my stress level is pretty high. Please bear with me. I hope you were able to get something from what I just shared. All right, thank you.
Oh my God. Thank you so much, Mrs. Okereke. Am I audible? Can you hear me?
Yes, I can.
Oh, thank you so much, Mr. Kerege. God bless you for sharing that. In fact, I can see you are a lecturer, because it is only a lecturer that will explain the way you have been explaining. I mean, there are a lot of things to learn. You've had five five amazing kids with PCOS. You've really gone a long way, and you've shared with us how you were able to conceive. So, before asking or before getting the questions from the people and answering them, I have some things in my mind that I just want you to touch on and tell us on. So you said you place yourself on fruits, yeah? How long was that for you before you conceive? I mean, you were saying that while explaining, you said you place yourself on fruits and vegetables and all that. How long was that for you before you conceived? Was it that you were eating just vegetables for 6 months, for 1 year, or in every diet you eat, you have a particular vegetable and all those things? And that helps to, for your ovulation to be more active and for you to conceive. How long were you able to do that before you conceive? Because there are a lot of women here that are looking up to God that have PCOS and pregnancy is not forthcoming.
Okay, I actually ate fruits and vegetables for 1 month. It was not more than 1 month. I took Chromate the preceding month and I didn't take in. So I placed myself on fruits and vegetables for 1 month, and it was within that 1 month that I took in of my second.
Wow, that's amazing. So the fact that a lot of people do not understand that when it comes to carbohydrate, or let me say carbs, has a lot of things to do with insulin sensitivity or insulin resistance. And from what Mrs. Okereke has said, she's an endocrinologist. She's furthering her education in studying of hormones. And because she has been living with PCOS for 25 years, and she has proven skills how she was able to conceive 5 different times. For everyone watching this, even if you're not going to take anything home, if you know you're having PCOS, please go and remove sugar from your diet. And I think in our documentary, while we were doing the documentary, we went to a dietitian, and I think she also mentioned something like that. She mentioned that a lot of people living with PCOS, they crave carbs a lot. And when we say carbs, it means they crave anything sugary, anything carbohydrates, and those things are not beneficial if you're having PCOS. As a matter of fact, if you're having PCOS, you have to take more protein than carbohydrates, because when you take carbohydrates, they are released as sugar in your body system, and your insulin is resistant. Your insulin is not doing the work it's supposed to do, and that is where you start seeing a lot of women having something like high blood pressure, diabetes, what's it called, and a lot of symptoms. So if you want to increase your chances of ovulation, I beg, go and remove carbs. Moreni Keji said they said she should not eat white rice again. Please, if you know you are always a lover of white rice, it's better you switch to brown rice. Brown rice has fiber. Then, if you're a lover of bread like me, I beg, go and stop eating bread. And if you're a lover of anything that is canned, meat pie, or whatever, just try to focus on your diet. Because I could really resonate with what Mrs. Okereke was saying, why the dietitian was talking. He said PCOS can be managed more heavily when you focus on your diet. When you focus on your diet, the things you eat, the things you consume, it will help to manage your insulin resistance. And once that can manage your insulin resistance, then you are at more chances of having ovulation and for you to conceive. So if you're having PCOS, please go and focus on your diet. If you need to see a dietitian, please see a dietitian. And that is why I said the documentary that we'll be launching at the end of the month, you need to listen to our dietitian, the kind of food you eat, the kind of vitamins, because the dietitian also mentioned a lot of vitamins, inositol. She mentioned a lot of things that you should take for a person living with PCOS to increase your chances of conception and to reduce some, symptoms that you are passing through. So I have this question again for you, Mrs. Okereke. You said they should remove artificial sugar completely, knowing fully well that the food we eat in Nigeria now, a lot of it has sugar. So how can we eradicate that completely from our diets?
I don't think I got your question.
Okay, while you were speaking, you said for those that are having PCOS, for them to have a higher chances of conception, they should remove anything artificial sugar, right, from the diet. Scrap out artificial sugar. Don't take artificial sugar again. Now, knowing fully well that everything we consume in Nigeria as of this day, is it yam, is it rice, is it spaghetti, is it macaroni, whatever we consume, a lot of it have sugar. So how do people living with PCOS balance that on how they are removing sugar completely from their diet, and knowing fully well that majority of the food we eat are packed with carbohydrates or sugar?
We have two different types of sugar. We have the simple sugar and the complex sugar. So the simple sugar is the one I refer to. That's the sugar that are that contains simple sugar. That's sugar that are in easy to absorb form already, like soft drinks, sugar cubes, meat pie made with flour. Flour is already in ground form, so it's easy for the body to absorb flour. And every food that is processed, okay, yam is not processed until you pound it. Every food that is processed is what you want to get rid of. Like I said, we have two different types of carbohydrate, the simple carbohydrate and the complex carbohydrate. The complex carbohydrate are the ones that still retain 95% of their nature. That's yam, your yam, that is cut and boiled. It's still retaining at least 95% of its nature. So it still have its fiber intact that will slow down the rate at which your body breaks it down and absorbs sugar. But the other ones, simple sugar, they don't have fiber. Once you take it, it goes right into your blood. There is no barrier to the getting absorbed. Those are the ones that you need to get rid of. But if you want something so bad, then you should give it the most drastic action that you can come up with. So if you want to really improve your PCOS symptoms, you might need to cut down on your carb, even the whole carb. You might need to cut down on it. It does not mean remove carbohydrate entirely from your food. Just lower down the rate at which you could, sorry for that, you could eat very small amount of carbohydrate per meal, and then the rest will be protein, healthy fats, vegetables, fruits. It does not mean remove carbohydrate entirely, but eat very small amounts of carbohydrates. Hope I answered that.
Yes, thank you so much. So I think this now makes a lot of sense, and that is why they tell people that have PCOS or those living with PCOS that there's something we call portion control. Like half of your plate should be more of vegetables and protein. Quarter of the plate should then go for carbohydrates. Carbohydrates shouldn't be more because unfortunately a lot of food that we eat lately are rich and packed in carbohydrates, and of course food that are rich and packed in carbohydrates, they end up giving us sugar. So thank you so much about that. Then you mentioned something because there are a lot of, but before I go to that, you said something like declutter your kitchen. I don't understand that part. Like declutter your kitchen, which means it that they should buy fresh food, don't put canned food and whatever. What do you mean by declutter your kitchen so that those are hearing you and can understand better?
What I mean by that is that, for example, let me use plastics for example. Plastic contains what is known as BPA, and BPA is a hormone disruptor. It kind of destabilizes the hormone, and PCOS is already a case of hormonal imbalance. It's going to worsen the hormonal imbalance. Using plastics worsens hormonal imbalance. Anytime you eat food, especially food that are not dry, food that contains more moisture. Anytime you eat food contained in plastic, food that contains moisture contained in plastics, anytime you eat it, you ingest some level of BPA, and BPA disrupts the hormone, so it's going to worsen your hormonal imbalance. I think
Hello.
that.
Yes, we're all for
Did
you.
you get my answer?
Yes, yes, yes. Oh, you mean so for those of us that are storing food in the freezer now with plastic, we should go and bring them out and get something to do. Yeah, it's very important we do that. Thank you so much for sharing your journey and your story with us. So, someone is asking a question. Someone said, "Thank you so much, Ms. Okereke. It is so this this session is so packed, and you have given us so much insight. Thanks to the organizers. Thank you too." So someone is asking, have anyone okay. Someone said, "I crave for sugar a lot. I've tried to stop, but I still find myself taking it. It has been really difficult. Please, ma, How were you able to modify your diet? So Tori B said she craved for sugar a lot. She has tried to stop it, and it has been really difficult. How were you able to modify your diet?
One thing about sugar craving is that the more you satisfy that craving, the more you crave for sugar. So you might need to one, place yourself on a sugar fast for like 14 to 30 days. The thing about sugar is that once you take sugar, because of that feeling that comes with the good feeling that comes with taking sugar, you might want to take more sugar. The more you take it, the more you feel like taking it. But if you're able to place yourself on 14 to 30 days sugar fast, it's going to reduce, and you don't do it like you don't you don't just dabble into it. You can start by reducing the amount of sugar you take. If you've been taking um like how do I put it now? How do I quantify the sugar? If you take sugar like 10 times in a day, you might want to cut it down to like 5 times to bring down the number of times you take sugar. Or you can place yourself on 14 days sugar fast without testing sugar, and it's going to help you overcome the sugar craving. Another thing that might help with that is placing yourself on a fast. Placing yourself on a fast can equally help, because what actually triggers sugar craving is insulin resistance. But if you're able to, because your cells are not getting enough glucose, that's what causes the sugar cravings. Your cells are not getting, the sugar is there, but they are not available to the cells. So because of the fact that your cells are not getting enough glucose due to insulin resistance, it will keep craving for more sugar. But if you can place yourself on a fast, it's going to help improve your insulin sensitivity and, of course, help you to curb that sugar craving.
Wow. So I hope she has answered your question. For someone that asked that question, thank you so much for answering that question. So please cut down your sugar. You can go on a sugar challenge. Just get a group of people that know. I belong to a community that they do 30 days no sugar challenge, and it's a good thing. But sometimes on the way, sometimes I break it one time and two times. When I break it like that, I try to start all over again. So you can do that, but for you to go without sugar for 10 days, you really done a lot for yourself. So you can, encourage yourself with challenges like that. And things you can sugar. So if you do that, I you have, like Mr. Kereke said, the level of conception can go up, ovulation can, be released, and you can have higher level of conception. So thank you so much. Another person said, thank you so much, Mr. Kereke, for sharing your story with us. He said, as an endocrinologist, okay, um, can you enlighten us on skincare products? Another person said, we said we should reduce our sugar intake. Is it advisable for me to so I take it every day because I have been losing blood for close to 2 months now. So someone is asking you, is it advisable for her to take yogurt or fresh yo because she takes it every day, losing blood
Hello,
for
Mrs. Obeyemi.
yes.
Mrs. Obeyemi, please give me a minute. I'll be back. Give me a
All right,
minute.
all right, no problem. Okay, so before she get back, let's get to answer some question. Um Zubeida, are you there? Mureni Keji, are you there? There are some questions for you.
Okay,
Yes, I
yes,
am
we're
here.
here.
Okay, thank you. So let me go on with the question for Mureni Keji. I'll ask the one for Zubeida. Someone said, can PCOS cause miscarriage in pregnancy? Mureni Keji, you have gone through a lot. God reward you for sharing your story with us. I think that question should be for Zubeida because she explained something like how PCOS causes miscarriage, right? So if you go through not to sound repetitive, if you go through the beginning of this webinar, of the live webinar, you would see where Keji was speaking about PCOS and miscarriage, so that we don't waste our time so much for that.
Okay,
Please
let
go
me
back.
have the question again, please.
Okay, so Mr. Kereke is back. She said, you said we should reduce our sugar intake. Is it advisable for me to take yogurt or fresh? I take it every day because I'm losing blood for close to 2 months now.
Fresh what? Is it
Fresh,
advisable to take what?
fresh yogurt or
Yogurt. So long as it's not sweetened, it's okay. Yogurt is fine for your gut health. It's very, very wonderful. And it's going to help you improve your PCOS symptom a bit. Yogurt is very okay, especially if it's not sweetened, not sweetened yogurt. Oh. Unsweetened yogurt like Greek yogurt is very, very okay.
amazing. Okay, I think this reminds me of someone I'm following. The PCOS survivor. In all her food, she usually use yogurt to make it. Like she use yogurt all the time, but I don't know if it's sweetened or unsweetened. But I'm always seeing in all her videos where she's taking a scoop of yogurt, and when she's narrating, she'll tell you she loves yogurt a lot, and she use yogurt to make, especially all her foods and all those things. That's because it kind of reduces her symptoms of PCOS. So I think yogurt is good, but fresh yo, I think fresh yo is processed, so I wouldn't
It's
advise.
sweetened. So
And aside
fresh
that, fresh.
is not okay.
So I would rather you go for Greek yogurt than fresh yo, please. Fresh yo is processed. Okay. Another person is asking, I was also told to stop taking vegetables as it will increase bleeding. Please shed more light on that. He said she was told to stop taking vegetables as it would increase her bleeding. How true is that?
That it will increase our what?
Bleeding.
Bleeding. Like I said, symptoms of PCOS varies. You just need to pay attention to your body. There are people that are sensitive to dairy products like eggs, milk. You just need to pay attention to your body. If you eliminate vegetable and your bleeding is still the way it is, then there is no point in eliminating it. But when you eliminate it and it reduces the rate of bleeding, the rate at which you bleed, then you might consider eliminating it completely. Okay, you just need to pay attention to your body, listen to your body. Our body talks to us all the time. You just need to listen to your body. If you are sensitive to vegetable, you might need to remove it from your diet.
Your diet. So it's not like a general problem. It's
No,
just
it's
that
not.
if you are sensitive to it, then you might need to remove it from your diet. Thank you so much. Someone said Greek yogurt are also sweet. There are some Greek yogurt that are unsweetened. They write it on the body, unsweetened. So please, it's better you go for the unsweetened one than the sweetened one. But me, I used to think, oh, why would you be drinking yogurt? You will not enjoy yogurt. I'm just thinking out loud. I love to enjoy my, but because of the condition and all that and the sugar you are trying to prevent, please take on sweetened. Abeg. Thank you so much. So, someone said, I'm going to take these last questions because I have a lot of questions for the other speakers so that we can round up as early as 9 p.m. So, someone said, can you share alternatives for plastic wares in the kitchen?
You can use bottles. There are bottlewares in the market that you can use to store food. They are better than plastics.
Okay, so if I want to stock, what is it called? Whatever it is I want to stock, I should go and get the big bottles and pour it inside, seal it, put it inside my freezer. Okay, so she said you can get bottleware in the market, and that should be fine for you. Thank you so much, Miss Okereke. God bless you. God
I'm
bless you for
blessed.
sharing with
God
us.
bless. Thank you
So,
for having me.
thank you. Please stay on
Thank you for
board.
having me. You said?
I said, please stay on board. We might still have some questions for you. So let me go back to Morenike and Zubeida. There are some questions that are there. Someone said, Miss Zubeida,
Okay.
I, I've heard that it's possible to ovulate without menstruation. Is it a disease condition? Can you address it as an embryologist?
Okay, wait, let me get the question right. She said she has heard that you can actually ovulate.
Without menstruating. Is it a disease condition? And can you address it as an
Honestly, I don't have knowledge on that, so I can't say that. But I know it's
or
actually possible for you actually have your period, but you're not ovulating with something called an ovulatory.
condition?
Yes,
Yes.
that is what I know of. But the question, I don't know, is it a mistake? Was it an opposite? I don't know.
Yeah, that question. Question is, I'm going to answer that question. Our question is it possible to ovulate without menstruating? The answer is no. It's not possible.
No.
You have to menstruate before you ovulate. That is the way it is. That is the way nature makes it. If you
But,
look
but
at
yes, yes, but you can have your period without ovulating.
without ovulating, exactly. You
Yes.
have period without ovulating. But
But
that
you
period
cannot ovulate and not you cannot ovulate without having your period, but you can have your period and not ovulate.
exactly.
Sorry,
So
can I
that
say something?
Okay?
yes, friend, in case you say something.
I feel it's possible. It has happened to me.
Okay.
I ovulated, I took in without seeing my period. So it's very possible.
Wow. Like you took in, you were pregnant without seeing your period. Is that what you're saying?
Yes, youthful exuberance.
Okay. Wow. I'm just hearing that for the first time. Wow. But maybe like, you were not menstruating, yeah?
Like I did not menstruate for 10 months.
Wow.
Like for 10 months, and let me say the 8 months I was pregnant without knowing though. But I later found that. So then I think I was in the university as at then. So it's very possible.
So wow.
Okay. Let's say is one of those, let me say, in every what there are some lucky times or something, because what I know is when we look at the female reproductive cycle here, the way the female reproductive cycle works, you enter the luteal phase to the follicular to the there are some phases like that where your luteinizing hormone comes down, then it goes up and all those things. So your ovulation comes period. That means if you do not have that period, ovulation may not come. There may not be release of eggs here, and that is why ovulation is linked to menstruation. But however, since you said it's possible, I guess we'll have to make more research about that. Maybe it's just one of those things. For example, I've heard women that told me that they also got pregnant without, would I say, while menstruating, they got pregnant. And I'm like, that is not the normal human physiology, right? You're not supposed to get pregnant while you are menstruating because
Can
when
I
you are
say
menstruating,
something, Miss Sabine?
people have said
Can
it
I say
that
something
yes, go on.
on that? It's possible for a woman to ovulate without menstruating. PCOS is I don't know how to qualify it. It's a crazy condition. Is a crazy condition. So the most significant way of finding out your fertile period is to monitor your discharge. Once you start, it's not like normal women that monitor with the finger test. Once you start having more mucus, once you start releasing more mucus, then it's likely that your ovulation is around the corner. So you can actually ovulate without menstruating.
Wow. Okay. They have said it they said you can actually, I mean, PCOS, not a person without PCOS. So,
PCOS.
oh, without menstruating, PCOS comes with a lot of irregularities in the
Yes, a
body.
lot of hormonal imbalance here and there.
So I guess that is possible that because of that, anything can happen. And PCOS is one complex, it's a complex disorder, right? It's complex. That a lot of things happen at the same time. So many things come to play at the same time. Honestly, those that are having PCOS, giving them some allowances for living with PCOS because it is just not. All right. Thank you so much for sharing that. So, this question, Zubeida, you do have plenty questions. So many questions to you.
Okay, because of the time,
Yeah.
and we still have one speaker to go, right?
No. We are done. I'm the last person. So I've been moderating and all those things. We do not
Okay,
have
okay. I thought we still
round
have
up.
this.
Be able to round up by 9 p.m.
But
Once
even if we can't answer everyone's question, they can always send me a DM on Instagram. I would always reply to questions.
definitely. So after this, I'll share all your social media and so they can reach out to you and all that. Okay. Somebody said having PCOS is are really going through a lot. Thank you for that. Okay. Someone said thank you, Ms. Okereke, for sharing your story. Thank you, Ms. Okereke. We've answered this. So someone said, this is to Mrs. Okereke. Say, what
Nah,
if Ms. Okereke, are you there?
Yes, I'm here.
Said, what if all these things are taking moderation than stopping it? What can you say about that?
You said?
He said, what if all the things you that okay, they should remove sugar, they should remove artificial this, remove processed food and all that. That what if it is taking it rather than stopping it? Will it still affect or will it still get what they want?
I've not still gotten the question. What if is what?
Can you hear me now?
Yes, I can hear you.
No, they're talking about things they shouldn't take, the sugar, the this, the that. So what if they take it in moderation rather than stopping it? Will they still have the same result?
What if they worsen the situation? Is that the question?
No. What if they take it in moderation? Moderation. What if they take it
Okay.
rather than
Please,
stop?
it depends on what you want. If it's pregnancy you want and you really want it so bad, then I think you should remove it entirely. And if your symptoms are so bad, I think you should also remove it entirely. But if you're having mild or moderate symptoms, you can take it in moderation, it's fine.
Okay. So did you hear? If you're having mild or moderate symptoms, moderation, but if you're targeting pregnancy, just avoid it for that period so that you can achieve the pregnancy that you want and everything you've always wanted. So she said you should remove artificial sugar completely. Artificial sugar, just dump it. Processed food, don't process food for now. Vegetables, take a lot of vegetables within 1 month, fruit and vegetables, and see how your body will turn out to. Then remove canned food from your food, bread, meat pie, soft, whatever. White rice, you should rather go for brown rice. So stop it. Then she said reduce your stress level significantly and declutter your kitchen, feed on good food, don't use plastic. So someone is asking that how do you okay, as an endocrinologist, what can you say about fatigue, high cortisol level in PCOS?
Fatigue and what?
Fatigue and high cortisol level in PCOS.
And high.
Cortisol level, high cortisol level.
What causes high cortisol level is stress. Cortisol is stress hormone. So once you are either mentally, emotionally, financially, or physically stressed, you have a high level of cortisol. And cortisol worsens insulin resistance. And insulin resistance can make you feel fatigue because your cells are not getting enough glucose supply. So it can make you feel tired.
Okay, so did you hear that? So cortisol generally is a stress hormone. When you are stressed, it is released, and when that is released, it affects your insulin resistance. So that is why you are able to get it. It's so straightforward. Then someone said, can you enlighten us about PCOS and incompetent cervix? I think PCOS and incompetent cervix, they are two different topics. I don't think they are related in any way. PCOS and incompetent cervix. They are two
An
different
incompetent what?
cervix. I think they are two different
Cervix,
questions.
no, they are not related.
Yeah, they are not related. Okay. So if I'm to talk about PCOS and incompetent, PCOS is one thing on its own. Incompetent cervix is another thing. They are not related. Coco, I hope we answer your question. They are not related in any way. So thank you so much for that. So let me go back to questions that was asked for who else. Okay, I think I have some questions there. I can't see it on my other phone. So sorry. I'm trying to check out the questions so that we can round up. Take two more questions, then round up. I can't see the questions again. Oh, I don't know what is happening. Live charts. Okay, I've seen the question. Hmm. So someone said, oh, I think there are some questions that I've missed here. When I went off and I joined back, I couldn't access some questions again. Yeah. So for anybody having any other question, please reach out to us on WhatsApp. Reach out to me on WhatsApp. I'll direct your questions to all the speakers. We'll give you their social media handle. As a matter of fact, we'll post their social media handle on the group, and you can ask questions from them. Yeah. So I can't see any other questions. I know there was a lot of questions before I went off. Yeah, there was a lot of questions before I went off. But if you have any question, reach out to me on WhatsApp. I will, is either I answer your question or I direct you to any of the speakers to answer your question. So thank you so much for joining us tonight. Then we also have, for those that do not know about me, please guys switch to my bio. So we have a documentary coming up on PCOS. That is the main reason why we're even having this webinar in the first place, to tell you all about the documentary, tell you all the work we have put into this documentary. We've sought out amazing speakers, amazing people that share their story on, on their journey on PCOS, how they were able to navigate and all that. And most importantly, we brought people from different fields that are going to tell you. There are medical doctors there that will tell you what PCOS is, how you can manage it. We have a dietitian that will tell you the kind of food you eat, your lifestyle modification, and all of those. We have a fitness person tell you the kind of exercise you can do at home without breaking the bank, without go to and all those. So I expect everybody to, or would I say I encourage everyone to expect the documentary. Before the documentary release, we are going to do a premiere, then we are going to do the documentary release. Once the documentary is out, please jump on the documentary and listen to every single thing, because we are using the documentary to create more awareness, create advocacy, and to get people out there to know more about PCOS. And even before the documentary is released, if you are here, please subscribe to our YouTube page, because once you subscribe, once the documentary is launched and once we have the trailer of the documentary, you'll be notified so that you can watch the trailer then before the documentary is launched. Please, for everyone that is here, kindly subscribe to our YouTube page. Kindly subscribe to our YouTube page. Then you should give this information to people in your corner, to people you know. A woman does not have to be stigmatized because of PCOS. Everyone needs to have adequate information and knowledge about PCOS. And I'm glad we are doing this. We started the documentary since last year, 2023. I'm glad that we've been able to come to something tangible. And we've gotten a lot of speakers to say wonderful things inside the documentary. I'm sure you don't want to miss out. I am sure you do not want to miss out. Somebody said, Mr. Kereke, I need your service as an endocrinologist. Please reach out to me. I'm going to share a contact. Then you can have a service as an endocrinologist. So then somebody said, can you tell PCOS sufferers, please send these questions on WhatsApp. We started since 6 p.m. and now it's to 9. We want to round up. Please send all your questions on on our WhatsApp. And please give us kudos if you really enjoy this webinar. Please tell us how this webinar has impacted you. Tell us 1 or 2 things you've been able to learn from this webinar. And for those that have questions that we've not answered your questions, feel free to reach out to me. I'm going to connect you with whoever you want to speak to. I'm going to connect you with any of the speaker that you want to talk to, and they are just going to answer your question. But please, that does not mean you should bombard their DM. As a matter of fact, I'll just give you the social media handle so that you can reach out to them on social media and they will get to answer your question. Yeah, then the wonderful thing we are doing, or let me say the most important thing we are doing for everyone living with PCOS that watched the documentary, is that we are connecting you to a support community. We are connecting you to a support community. So if you are here, if you are living with PCOS, after the release of the documentary, for everyone that has PCOS, we will add you to a group and we'll connect you to a support community. We have a popular person on Instagram. She owns a support community. If I mention her name, a lot of you would know her. We've been able to partner with her, and she says she's ready to welcome everybody, people that are having PCOS that wants to join our community. So the community is open for everyone that wants to get more information, more resources, most especially those living with PCOS that want to get adequate information, adequate resources about PCOS, that want to belong to a group of people living with PCOS so that they won't be left out or they won't feel left out. So what we are doing after the documentary release, we'll connect everyone living with PCOS that attends our webinar, that watch the documentary. Will connect you to a support community so that you can, get to interact with people over there and tend to get more support. If not that we do not have adequate resources, we will have said for those living with PCOS, we are going to connect them to fertility clinic. But unfortunately, we do not have that resources. But if God lays in your heart and you are here and you have that resources for you to support us, for people to reach out to fertility specialists or fertility clinic, please, we are open to donations and we are open to sponsorship and all that. In fact, we are open to partnership. So if you are here, if you know someone that knows someone that knows someone that is very big or that is ready to support us, please feel free to reach out to me. My DM is open. Feel free to reach out to me so that we can partner together to get this, our documentary. Our focus is our documentary, to get the documentary to reach millions of women and girls out there so that they can be aware about PCOS. Yeah. So then we wish to launch the documentary on what would I say? We wish to launch it on Netflix. We wish to launch it on Prime Video. So if you have the capacity, if you have the means, please, we spend a lot of resources and money and effort on this documentary. In fact, when you watch the documentary, you'll be glad you watched the documentary because it's going to tell you everything about PCOS. And you are hearing from people that have the knowledge, right? So if you have the resources to support our journey, to support us to launch the documentary, or someone that can help us to launch the documentary on Prime Video or Netflix, please feel free to reach out to me. Thank you so much, everyone. You can see my bio on the screen. I have a very big, robust bio, so you can read it out, and I will expect your feedback if you have any support for us. Thank you so much, everyone. Thank you, and God bless you. Morani Keji, thank you so much for joining. Zubeida, thank you so much for joining. Mrs.
Thank you
Okere,
so much.
for joining. Please, if you are just joining, you've missed a lot, but I have this recorded here. I'm going to edit it, then put it on our Instagram live on our YouTube live, so that everybody will be able to have access to it. I'll put this on our YouTube live so that everybody will be able to have access to it. Please, for the rest of the people here, do well to subscribe to our YouTube page. We have a lot of values we are dropping on our YouTube. Do well to subscribe to our YouTube page. It won't remove anything from your body. Come on. And to serve as a support for we giving you this webinar, bringing these amazing speakers on board. So what would it take you to subscribe to our YouTube page? It won't take anything. So please do well to subscribe our YouTube page. And I think we've exhausted a lot of our time. If you have any question, do well to reach out to me. I'll connect you to whoever it is that will answer your question. Thank you so much, everyone. Bye. Thank you for joining, Joy. Thank you so much. God bless you. Your people are sending there. Thank you.
You're welcome, ma'am.
Thank you. Thank you. How can we help in our little way? Please reach out to me on WhatsApp. You can help. Bye. Bye. Jimo Kabirat. Bye. Jimo Kabirat Bolajoko. So how can we help in our little way? Please reach out to me. Someone said you have done a great job. Thank you so much. Someone said thank you so much for the webinar. I appreciate you. Someone said this was so impactful. Thank you so much for this wonderful webinar. Thank you, thank you, thank you. I appreciate you all. Please subscribe to our YouTube page. Don't forget to subscribe to our YouTube page. Let me see the subscription going on and on. Somebody said, thank you for your contribution. The session was enlightening. Bye. Thank you. Thank you. Thank you. Bye. Bye. Please reach out to me if you want to help us. I can see someone saying, how can we help in our little way? Please feel free to reach out to me. Thank you so much. God bless you. Nothing is too small. Please reach out to us. Thank you. Thank you. Thank you. All right, Joy. I'm going to end the live now. Okay.
All right, ma'am.
All right. Take care of yourself. Bye.
You too,
Thank
ma'am.
all the facilitators and presenters. Thank you so much, Labiba. Right. Thanks to you too. Bye. Thank you so much, guys. Thank you for joining.